Kilala ng mundo, katapangan mo at kabutihan ng iyong puso. Ipagpatuloy mo, adikain ng mga bayaning nagbuwis ng buhay para sa iyo.
Muling buhay ng alab at ninas ng pag-ibig mo. Iwagayway pandilang sa gisag ng dangal ng tabang at ng kalayaan mo. Ipakita sa mundo ang diwang makabayang nasa puso't isip mo. Ika'y isang lahing pinagpala ng may kapal. Katatagan at tapang mo'y hinubog ng kasaysayan. Sa katapatan mo, karangalan ng iyong lipin ay itatanghal. Kahit saan pa man, taas noo kang hahakbang. Pilipino ka, huwaran ng paglilingkod. Sa mundo'y siyang kapal.
Saan mang panig ng mundo, laging nangatangking galing mo at talino.
At pinatunayan mo sa bayanihan at pagkakaisa'y makakamtang lahat pangarap mo. Muling buhayin ang alab at ningas ng pag-ibig mo.
Iwagayway pandilang sa gisag ng dangal siyang gabay. Muling buhayin ang alab at ningas ng pag-ibig mo. Iwagayway bandilang sa gisag ng dangal, ng tapang at ang kalayaan mo. Ipakita sa mundo ang diwang makabayang nasa puso't isip mo. Ika'y isang lahing pinagmana ng may kapal. Katatagan at tapang mo'y hinubog ng kasaysayan. Sa katapatan mo, karangalan ng iyong lipid ay itatanghal. Kahit saan pa man, taas noo kang hahakbang. Pilipino ka, huwaran ng paglilingkod, sa mundo'y siyang gabay. Isang bayang makulay ang pinagmulan, bagong bayani ang taglay niyang kayamanan. Tanyag dahil pagbabago'y mapayapang pinaglabang, isang perlas kung saan sumisikat ang araw.
Nakilala ng mundo, katapangan mo at kabutihan ng iyong puso. Ipagpatuloy mo, adhikain ng mga bayaning nagbuwis ng buhay para sa iyo.
Muling buhayin ang alab at ningas ng pag-ibig mo. Iwagayway bandilang sa gisag ng dangal, ng tapang at ng kalayaan mo. Ipakita sa mundo ang diwang makabayang nasa puso't isip mo. kahit saan pa man, taas noo kang hahakbang. Pilipino ka, huwaran ng paglilingkod, sa mundo'y siyang gabay.
Saan mang panig ng mundo, laging angat ang king, galing mo at talino.
At pinatunayan mo sa bayanihan at pagkakaisa'y makakamtang lahat pangarap mo.
Muling buhayin ang alab at ningas ng pag-ibig mo. Iwagayway pandigan sa gisag ng dangal, ng tapang at ang kalayaan mo. Ipakita sa mundo ang diwang makabayang
All right, good morning everyone. Magandang umaga po sa lahat and welcome po to our webinar. This is an initiative of the Philippine Professional Organization Qatar in coordination with Bayanihan and Hero Qatar, that is HERO Qatar, in the new normal era. So we would like to thank everyone. Nagpapasalamat po kami ng buong puso sa pagdalo niyo po sa ating webinar. So habang yung iba po ay nag-login pa for their attendance, so we all right now are almost 60 plus na po tayo ngayon. Okay? So we are streaming live via Zoom as well as YouTube account, that is Bagong Bayani Channel. Okay, kung nakikita niyo po yung yan sa ano niyo sa screen niyo. Ayan. All right. There you go. Okay. So would like, of course, to welcome the presence of our different organizations from the 14 strong organizations under the Philippine Professional Organization Qatar, from the Bayanihan as well as from Hero Qatar. Welcome for coming. So this is a free webinar initiative, again, of the Philippine Professional Organization Qatar in coordination with Bayanihan and Hero Qatar here in Doha. So as well with us right now, the presence of our different officials from the Philippine government here in Doha, Qatar. Okay, so in a while we will be having our final program flow during this activity. So today is the 12th of March 2021, and we will be streaming live from 9 in the morning until 11 in the morning as well. So this webinar activity aims for us to develop awareness. So gusto natin makadevelop ng kaalaman. Okay? Hindi ko ma-pronounce sa Tagalog. Kaalaman regarding sa COVID-19, sa updates, sa trends, kung ano bang nangyayari ngayon sa COVID-19. So may 4 po tayong topics ngayon that will be delivered by 4 brilliant speakers na invite natin here in Doha as well. So they will be discussing about ng una, regarding sa basics ng COVID-19. Okay? Pangalawa, they will also be discussing about kung paano natin maproprotektahan ang sarili natin with regard to this pandemic. Hindi lang yung sarili natin, kundi pati yung mga loved ones natin, yung pamilya natin, at kung sino yung mga kasama natin sa bahay. Pangatlo is on how we will be able to manage stress during this time of pandemic. And the fourth one is for us to know more about the COVID-19 vaccines. So everyone, just grab your cup of coffee and we will be starting in a while. Okay? So madami na ngayon yung participants natin and there we go. Okay. So sa lahat po na alam ko po, halos lahat po tayo off ngayon sa ating trabaho, and we welcome you to attending this activity. And sa mga nagtatrabaho ngayon, of course, kung nakikinig po kayo ngayon sa atin live, well, we are really appreciating that kind of gesture. And as well po, keep safe sa pang nagtatrabaho at mamaya po sa pag-uwi. Okay, so I think napupuno na po tayo ngayon ng mga participants. Wow. Okay, so I think it is time for us to start our activity. So to formally welcome us in this activity, let us first welcome our Philippine Professional Organization Qatar. And of course, that is no other than Mr. or Chairman, Engineer Adonis Q. Talabo, to welcome us all in this activity. You are still tuning live to Together Against COVID-19, live via Zoom and Bagong Bayani channel of the Philippine organizations in Qatar. Chairman?
Okay. Together Against COVID-19, the title itself speaks how Philippine Professional Organization Qatar, Bayanihan, Hero Qatar, and the Filipino community are united as one in fighting this pandemic. Filipinos in Qatar experience a lot of struggles, hardship. Some experience hopelessness due to unemployment, and others experience stress brought by the pandemic. There are two essential elements in addressing the pandemic effectively. Leaders must step up to take action, and citizens need to embrace new measures. This webinar initiative was initially planned due to the concern that were being raised by most of the Filipino communities to our healthcare organizations. And then we came up to materialize those plans since we have experts here in Qatar that can discuss and impart knowledge that can give advices to community who are facing fears about the virus. We hope by having this webinar, we can at least lessen the fears of our Filipino community, and we want the community to be aware as well that the Philippine Professional Organization in Qatar, together with the PULOA and the Philippine Embassy, are here to support our Filipino community, especially during this time. I would like to acknowledge the presence and support of our Consul General Russell Reyes, Attorney Russell Reyes from the Philippine Embassy, Qatar, Ma'am Evelyn Laranang of PULOA, their officers and staff, Bayanihan President Mr. Jerry Ronquielo, and their advisor Mr. Rizzi Fos, Hero Qatar Chairman Emeritus Engineer Henry D. Maano, and their President Ms. Malo Valientes, PPO officers, some are here, from AFIC, Doc Leo, Dr. Christian, Mr. Jason, Gob Kensley, Engineer Mike, Doc Cecil, and all other na mga organization presidents sa PPO. Maybe later, nag-breakfast pa siguro. And of course, to the PPO officer, Engineer Sherwin Caplanca, Engineer Jaime Fortaleza, and of course, our treasurer, Ma'am Mary Rose Oy. Actually, she's the one who initiated this event. Mr. Pittsdale Isloyo, the event organizer. Same time, our MC and coordinator. And then the speakers, which will be introduced later. Filipino community, a pleasant good morning to all of you. Together, we can overcome this pandemic, and together we will build the healthier, safer, and a normal world we all want to see. Thank you so much, and I wish we will all learn from this webinar.
Thank you very much, Chairman Adonis Talabo. Yes, indeed, we will be having a safer and a more effective new normal society later on. We believe in that. Okay, so at this point in time, let us proceed with our activity by asking grace from our Creator, by having an invocation, and that is to be followed by the Qatar and the Philippine national anthem.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, telas ng sinakalan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit mong pagaw, ay hinatang tulang awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin at araw niya kailan pang ay di magtitindig. Luman ang araw ng walhagit pagsinta, buhay langit sa piling mo. Ang inigaya ng pagkay mga api, ang mamatay ng dahil sa'yo.
Uli ko po magandang umaga po sa lahat and welcome po Together Against COVID-19, a free webinar initiative with the Philippine Professional Organization Qatar in coordination with Bayanihan and Hero Qatar in the new normal era. So at this point in time, habang nagkakape kayo, nagtsatsaa, or nagkakaroon ng breakfast ninyo ngayon, we will be hearing some short messages from our delegates dito sa Qatar. So those people who will inspire us in one way or another. So at this point, let me call on our Consul General, Russell Reyes, in the Philippine Embassy Doha, to give his short message.
Magandang umaga sa inyong lahat at maraming salamat po sa pagpapaunlak po sa amin sa araw na ito. On behalf of His Excellency the Ambassador Alan L. Tibaya, I would like to read a short message for the PPOQ today and the participating organizations, and on the occasion of this webinar. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. I thank the organizing committee for inviting the Philippine Embassy to this webinar event entitled Together Against COVID-19 that aims to provide awareness on COVID-19 to the Filipino community in Qatar. As you very well know, Qatar and the Philippines have started to launch their respective vaccination programs for their populace. While this is a welcome development, there is still some apprehension on the part of some individuals about getting inoculated. It is therefore important to raise awareness on this matter. I cannot overemphasize the importance of holding this online gathering today, as the COVID-19 health pandemic continues to pose a real threat to peoples and economies across the globe and will probably remain so for the foreseeable future. The COVID-19 health pandemic is a force to be reckoned with. Piecemeal response is certainly not the way forward to defeat this menace. If we are to tide over and overcome COVID-19, we will have to do so by working well together. We have seen people having been adversely affected in varying degrees. Worse, there have been people who are dear to us who have fell ill or have succumbed to COVID-19. Yet, despite COVID-19 casting a dark cloud over the horizon, we have been elated by several stories of resilience and determination, of people trying to brave the odds, most especially by stories of heroism, unity, and caring for others. Truly, the health pandemic, while it has tested our mettle, it has also highlighted the best in human character in the face of adversity. Hence, I say that the holding of this webinar event by the organizing committee is a quintessential example of the best of Filipino character and values, which in this case is the unselfish desire to empower and to care for others through this informative webinar. To the participants attending today, which I have been told are in multitude, let us learn together, be empowered together, and act together in the fight against COVID-19. I wish everyone a fruitful seminar and webinar, and keep well and safe. Maraming salamat po. Maraming salamat po, at yun po ang mensahe ng ating butihing ambassador po sa Qatar, His Excellency Alan L. Tibayan. Maraming salamat po.
Thank you din, Consul General Russell Reyes from the Philippine Embassy, Doha, Qatar. And of course, we would like to express our gratitude as well, even wala siya ngayon dito, to His Excellency Alan Timbayan, ang ating Philippine Ambassador to Doha. Okay, maraming salamat po. And we are still tuning live dito sa Zoom, and we are streaming live as well sa YouTube channel natin. That is Bagong Bayani YouTube channel. So please, if ever you are tuning right now, please don't forget to subscribe so that ma-update po kayo regarding sa mga happenings natin dito at program of the different Filipino communities dito sa Qatar. Okay, so at this point in time, let us hear from someone who would give us some inspirational talk. Okay, so let us welcome the Philippine Professional Organizations Qatar Treasurer for 2021, Ms. Mary Rose Uy. Ma'am Rose.
Good morning everyone. To all the viewers and participants of this webinar, welcome and have a blessed morning to all of you. Yes, as one of the frontliner and as one of the community leader, I witnessed how this virus affects the lives of the people, most especially our kababayans. During the peak of the pandemic last year, we were the part of the community swabber who volunteered under the Ministry of Public Health. And it was really a great experience that, we were able to help the country, who helped us also to be safe and give us all the privileges like the free quarantine facilities and provided us all the needed medical help that we require. We also have here in Qatar the free hospitalizations for those kababayans who were affected, who got positive in COVID. And also now we have the free vaccination. So I just want also to encourage all the Filipino community, if we can, extend or help the smallest way we can, please do it. A little comfort and, to make someone smile will help us fight this COVID. I just hope that by this webinar, we can at least ease the worries of our kababayans here in Qatar. And as a community group, this is also one way for us to extend our help to provide awareness to the Filipino community. Amidst the pain that we continue to endure, we should find comfort in the stories of hope and solidarity and continue to see the value in the positive way, encouraging lessons that are emerging to our post-COVID world. Once again, welcome to this informative webinar. Enjoy and have a great day.
Indeed, thank you, Ma'am Rose, the Philippine Professional Organization Qatar 2021 Treasurer and the President of the Philippine Nurses Association Qatar 2019-2020. Thank you very much. We will do it. Okay, thank you for that inspirational message. Now, at this juncture, let us welcome another one who will give us a message, a short message. The Chairman Emeritus of the Helping, Empowering, Recognizing OFWs or the Hero Qatar. Let us welcome Mr. Henry Dimaano.
Magandang umaga po sa ating lahat at unang-una po tayo po ay nagpapasalamat sa organizing team at sa ating mga guest speaker at sa ating sa presence po ng ating Consul General mula sa Philippine Embassy at mula sa ating polo si Ma'am Evelyn, si Conjan Russell Reyes. Ang pamunuan po ng Hero Qatar at Bayanihan ay lubos na nagpapasalamat sa mga ganitong programa, kapaki-pakinabang na programa na makakatulong sa ating mga kababayan. Wala po ako sa linya ng healthcare. Sa ngayon po, ang ibibigay ko sa inyong mensahe ay ang pagdating po sa batas ng Qatar sa usapin ng health precaution to prevent infectious disease, ang pag-iingat sa kalusugan upang maiwasan ang mga nakakahawang sakit. Ang batas po na ito ay nagmula sa Decree Law number 11 of 1968 na inamend po ng Decree Law number 17 of 1990 na mayroon pong kaparusahan doon sa ating mga kababayan o mga tao na lalabag doon sa precautionary measure. Ang Article 21 po noong ng Law number 17 of 1990 ay mayroong kaparusahan na 1 buwan o hindi lalagpas ng 3 buwan na pagkakakulong at mayroong katumbas na multa po mula sa 2,000 hanggang 3,000 Qatari Riyal. At ngayon pong kasalukuyan ng pandemya, nag-issue po ang ating mahal na Emir. Mayroon po siyang amendments ng ilan sa mga batas mula sa Law number 17 of 1990. At ito po ang Law number 9 of 2020 na in-issue noong 26 March of 2020. Panahong Abril po, naglabas po ang Ministry of Interior ng mga precautionary measure na video mula sa community leaders. At ang inyong lingkod po ay isa sa nagbigay ng mensahe. Ang sinasabi po doon po sa amendments ng Law number 9 of 2020 ay dinaragdagan po dahil po sa pandemya, ito po ay nakakatakot na pagsasalin-salin o pagkakahawa-hawa ng mga tao mula sa mayroong sakit. Kaya po, pinagtibay po at mas pinalakas po ang mga batas na ito upang maiwasan ang paglabag. Sa Law number 9 of 2020 po, ginawa na po, hindi lalagpas ng 3 taong pagkakakulong at hindi lalagpas ng 200,000 kataririya ang sinumang lalabag sa batas na ito. So mga kababayan, tayo po ay sumunod sa batas dahil dito po sa bansang Qatar nakasalalay ang ating mga pangarap sa ating sarili at sa ating mga mahal sa buhay. Ang pag-iingat po sa ating mga sarili ay pag-iingat na rin natin sa ating kapwa at sa ating mga mahal sa buhay. Again, maraming salamat po. At meron din po akong pahabol na salita dito sa ating mga kababayan. Maaari po lamang na tayo ay magbasa sa mga legit source, especially po sa social media. Alam natin po, ang social media po sa panahon ngayon, ang very powerful tools sa pagdi-disseminate ng information. Para maiwasan po natin ang magkaroon ng problema sa otoridad, maaari po lamang na huwag tayong mag-share ng mga news or information na hindi galing sa mapapagkatiwalaan source. Maraming salamat po.
Maraming salamat din po, Chairman Emeritus Henry Di Maano. Makakaasa po kayo na we will only be reading legit sources that are being disseminated po sa amin. Thank you so much. And this kind of activity, ginagawa natin is to create awareness sa ating mga kababayan right now in order for them to know what is really behind COVID-19 as well as the updates and the trends that are happening right now, not only in Qatar, but of course, worldwide. Okay, so at this point naman, let us welcome the officer in charge at Polo OWA Qatar, Ms. Evelyn Laranang, to have her short message. Ma'am, Evelyn? You are still tuning live po sa Together Against COVID-19. This is a free webinar initiative of the Philippine Professional Organizations Qatar, as well as the Bayanihan and the Hero Qatar. Okay, so right now let us welcome Ma'am Evelyn Larana.
First of all, let me greet each and every one of you a very pleasant good morning. We thank you all. We thank the Philippine Professional Organization in Qatar for initiating this educational online seminar on entitled Together Against COVID-19. Let's work together to fight this pandemic, which has been spreading widely, not only in Qatar, but also worldwide. It has been more than a year since this outbreak, but it has not stopped. So may I please request each and everyone to do its part in containing the virus. A simple wearing of masks, hand washing, social distancing, and observing other health protocols will be of great help in minimizing the spread of the COVID-19. So let's all help together to contain this virus. Thank you very much.
Thank you, Ma'am Evelyn Laranang from the Polo OWA. Yes, ma'am. Naniniwala po kami at kahit ako na each and every Filipino dito sa Qatar has a unique role para masugpo po yung pandemic na to. Every little effort counts. Thank you so much, ma'am. Okay. Now, at this point in time, alam ko excited na po ang lahat with regard to our activities. Once again, we have 4 topics that will be discussed by our 4 renowned speakers. The first topic will focus on the basics of COVID-19, then and now. Ano ba ang mga updates, tsaka ano ba ang pinanggalingan ng COVID-19? It is just to refresh us on these topics. The second one will focus on how we will be able to safeguard our own self as well as our family members with regard to COVID-19. The third one would be on how we will be able to manage stress in this time of pandemic. And the fourth one is sa pinakauso ngayon is about the COVID-19 vaccine. Safe po ba magpa-inject ng COVID-19 vaccine? Ano po mga side effects? At ano ang mga benefits na pwede nating makuha sa vaccine na to? Alright, so now, I don't want to prolong this, but I will be introducing to you our speakers. So our first speaker today will focus on the basics of COVID-19, the updates and trends with regard to this pandemic. To welcome us with our first speaker, let us welcome Mr. Sherwin Ricaflanca to introduce our first key resource person. Sir?
Brad,
Hello, good morning.
Brad,
Yes, Brad.
pwede mo na ma-interrupt kung baka may lakad yung iba. Bago mo basahin yung first speaker natin, pwede mo na tayo picture taking. Kasi parang may lakad yung iba na guest natin. Okay lang sa inyo?
Okay. Sige. Pa-switch on daw po ng video ng lahat. Si Chairman Henry. Chairman. Ano?
Sinong mag-picture?
Engineer Sherwin, ikaw muna mag-picture. Picture din ako.
Eh.
Thank you.
1, 2, 3. Alright.
Isa pa.
Isa pa. 1, 2, 3. Yun. Thank you.
Isa pa. Simula na.
Okay, so once again, let us welcome Mr. Sherwin,
Thank you.
Engineer Sherwin Ricaflanca to introduce our first speaker.
Okay, good morning ulit sa lahat. I've been given the pleasure of introducing our first speaker for today. So our speaker is the current secretary of the Philippine Nurses Association here in Qatar. She's a registered nurse in the Philippines and as well here in Qatar. And currently the medical director and quality control officer of a private health facility. Let's all welcome Ms. Vesa Lara Malain P. Raga.
Thank you. Thank you, Engineer Sherwin, for that nice introduction. Maraming salamat po. Before po ako mag-proceed to my topic, first let me say my thank you to the Philippine Professional Organization Qatar and Chairman Engineer Adonis Talabo, Bayanihan Qatar and Mr. Jerry Ronquillo, Hero Qatar and Mr. Henry D. Maano, and of course my organization, Philippine Nurses Association Qatar, and to all the officers who supported me on this, and of course the Filipino community. Again, welcome also to the Philippine Embassy and its representatives, Consul General Rosel Reyes, and the Polo Owa Qatar and representative, Ma'am Evelyn. Thank you for having me today. It is my honor. This is a privilege for me to speak with you, to present to you or to share with you my knowledge about COVID-19. Yep. So alam ko po, most of you, maraming nakapag-research na o they had already their research of what COVID-19, since it has been more than a year that this COVID-19 is within around us, or just around us. But before I proceed, by the way, I would like to thank in advance the technical committee who will help me to control my slides. So yeah, basically my topic would be basics of COVID-19 then and now. So ano nga bang history nito? Ano ba ang COVID-19? Ano daw ba yung mga new variants na kinatatakutan ng lahat sa ngayon? And ano ba yung mga signs and symptoms, ways to prevent, and the facts, okay? Facts about COVID-19 and updates on the trends of COVID-19 in the world, in Qatar, and in the Philippines. And before I proceed with my presentation, so I have nothing to disclose. I have no financial relationships with members of any pharmaceutical or medical supply companies. I do not hold any research grants funded by any industry, and I do not serve on any advisory board of any for-profit industry. So let's start na po. All right. So ano nga ba ang COVID? So what is COVID? Next slide, please. So COVID is a new disease caused by a novel or new coronavirus that has not previously seen in humans. So the World Health Organization, Qatar, first learned of this new virus in December 31, 2019. So last day of 2019 talaga, no? So yun. And this was discovered following a report of a cluster of cases, meaning marami talagang affected by a certain viral pneumonia in Wuhan, China. So its origin accordingly is Wuhan, China, and it was called 2019 novel coronavirus or 2019 nCoV. Natatandaan ko po, nasa Philippines ako nung time na to, bakasyon ko, nang in-announce ng Philippines na there is a certain outbreak called 2019 nCoV. But as they go on studies, they changed its name to COVID-19. So why COVID-19? Because COVID-19 stands for CO for corona, V for virus, D for disease, and since it was discovered in 2019, it was called COVID-19. And this COVID-19 is caused by a new coronavirus called the SARS-CoV-2. So now, what is SARS-CoV-2? So again, on February 11, the World Health Organization announced that severe acute respiratory syndrome coronavirus 2 is the name of the new virus, since this is a new disease caused by a new virus. So this name was chosen simply because this virus is genetically related to the virus that caused the SARS outbreak in 2003, in 2003. And just so you know, these two viruses are related, but still they are different. So magkaiba pa rin siya. Later on, when we talk about mutation and variants, you will understand, okay? So next slide, please. All right, so what's the difference between influenza or flu and COVID-19? So when we have the COVID-19, actually later on with the signs and symptoms, COVID-19 has almost the same signs and symptoms as of influenza. Kaya medyo nalilito tayo kung yung simpleng sipon ba is COVID-19 na, or this is just a flu or like that. But technically, those diseases are both contagious. Okay, nakakahawa ito. Okay, parehong nakakahawa, pero like what I've said, they are caused by different viruses. So for COVID-19, it is the SARS-CoV-2, and for flu, it is caused by the infection with influenza viruses. So yun yung difference niya. Magkaibang virus ang reason or ang dahilan or ang cause ng different diseases na ito. And for COVID-19, based on the observation and studies, it seems to spread more easily than flu. So this is more contagious than flu, and it causes more serious illnesses. And kagaya nga na nangyayari sa mundo, masyadong maraming affected and masyadong maraming namatay dahil sa disease na ito than the normal flu or the some seasonal flus. And COVID-19, sa COVID-19, mas matagal kasi mag-show yung symptoms. Sometimes it takes like 14 days, maximum of 14 days para magpakita or lumabas yung sintomas ng COVID-19. And COVID-19 is more contagious, or it is contagious for longer. So mas matagal na nakakahawa ang flu. Some flu viruses, sabi nga, is like contagious for certain days, maximum of 7 days, while COVID-19, it depends on the status of a person. Minsan tumatagal talaga siya ng 14 to 21 days. That is why meron nga tayo nung mga quarantine and isolation na sinasabi. Okay? So yun ang difference po or ang pagkakaiba ng flu at ng COVID-19. And just another fact before I proceed to the second part or to the next part is that yesterday, March 11, 2020, was the anniversary when the World Health Organization declared that COVID-19 is a pandemic. So, isang taon na nang idineklara ng WHO na ang COVID-19 ay isang pandemya, and this is the only anniversary not worth celebrating of, diba? So parang no time for celebrations until this COVID-19 talaga is mawala na at all sa atin or sa mundo. So ayun. And by the way, before I proceed, I just want to inform everyone also, kagaya nga ng sabi ni Sir Henry, na kailangan reliable ang mga sources natin. So lahat ng sources ko or my references are coming from the World Health Organization, the Center for Disease Control and Prevention, or the CDC, the Ministry of Public Health Qatar, and the Department of Health in the Philippines. So, new variants. Mutation variants. So, actually, even myself, I felt panic and fear when I heard the news that coronavirus has mutated. Okay? So, and there are new variants that causes COVID-19. But well, in fact, all viruses, including SARS-CoV-19, evolve over time. So it changes, it evolves. Pero what do we mean by mutation and variants? So for us to lessen our anxiety about the new variants of the COVID-19, so let's define first what is mutation, o kung ano mutation, and what is variant, o yung mga uri ng COVID-19 viruses na ito. So what is mutation? So when a virus replicates or makes a copy of itself it sometimes changes. So may certain changes, may pagbabago, which is very normal po sa virus. So based on the studies. So these changes are called mutations. Okay, kagaya nga nung pinakita doon sa mga first, sa 2 slides ago, there are different coronaviruses, the pictures of coronaviruses. So those are the variants naman. So what is the variant? So a variant naman is if a certain virus has or had one or more new mutation, so that is what you call the variant. So yun, that is mutation and variant. So I maybe yung iba sa inyo is alam yung story or yung movie, Korean movie na Train to Busan. So siguro ito yung nagre-remind sa inyo about the mutation of a certain virus because in this Korean movie, there was an outbreak wherein most of the humans turn into flesh-eating zombies, and as a man, kasi meron, di ba, yung mag-ama na sumakay ng tren from Seoul to Busan, so naka-encounter sila ng mga flesh-eating zombies due to mutation of this certain virus. So anyway, it's just a movie. I hope di talaga siya mangyari. Pero to lessen also our anxiety about this mutation and variants, kasi honestly talaga, ako din as a healthcare professional, very anxious talaga ako nung nalaman ko on when I heard about, may bagong variant na naman. Ano ba tong mga bagong variant na to? Pero honestly, mutations happen every day. Okay? So viruses, bacteria, all microbes, and even animals undergo mutations. And research shows that in an average person's somatic cells or within ourselves is nag-undergo din ng genetic mutations or thousands of genetic mutations every day. It sometimes nagbibigay ito ng positive, nagbibigay ito ng negative result or negative effect to one's body or to something. Nagbibigay din to ng positive result sometimes to to someone's body or to something, and meron din na even nagkakaroon ng mutation, no effect at all. However, it is always good for us to be alert. Okay? Alert by means of taking all the precautionary measures. Okay? With regards to the precautionary measures and ways to prevent the spread of this virus, I think our next speakers will go in depth about this, or our next speaker will go in depth about this. But now let me proceed to discuss to you about the multiple variants. Can we go back to the previous slides? Thank you. So accordingly, so from the WHO and CDC, there are 3 known new variants of corona or COVID-19. So first is the UK strain. So the UK strain is identified or called as B117 with a large number of mutation in the fall of 2020. So according to the studies, this variant spreads easily and quickly than other variants. So kaya napapansin nyo, if you are really monitoring the updates and trends, especially dito sa Qatar, nag-i-increase na naman yung numbers of people who are infected with COVID-19. Because during a press conference on COVID-19 by the Ministry of Public Health, there were cases identified with this kind of variant in the region and in Qatar. So they are strictly monitoring about this specific virus, the B117 or the UK strain that nandito na siya sa Qatar, and yun nga, they're still monitoring its spread, or they are giving restrictions for this not to spread. Okay? So another variant is the one from South Africa, or the South African variant. So another variant called B1351. So this is a mutation from with B117. So that's what I've said. So there is a change from B117. There is it evolved, or there are some changes. It copies itself, but there are some changes. So may konting pagbabago, and this was discovered in South Africa. So this is B1351. Sorry. This was detected last October 2020. Okay. And there are also cases of this in USA, and it was detected in January 2021. Another variant is the Brazil strain. So it is called the P1, and it was discovered or first emerged when some travelers from Brazil who were tested during a routine screening, the usual swabbing. If you go to one country to another, so they have their own policy, they have their own protocols. So they had the routine screening, and in Japan, it was discovered in January 2021. So it was detected just this year. So accordingly, these new variants are more contagious, and like what I've said, spreads more easily between people than the existing strain. So the first strain that we have without the mutations and all. So, and that's it. So, and it causes more of it causes severe or increased severity of the disease. But according again to the Ministry of Public Health, the good news is that the vaccines available in the country, sorry, I am not promoting either of the companies, but currently what we have right now is the Pfizer, BioNTech, and the Moderna. The ministry claimed that these vaccines are effective against the new variants also, as well as from the World Health Organization and CDC. They are saying, or they are telling that, like that. So this vaccine are effective. So, all right. So what are the signs and symptoms of COVID-19? So first is cough and colds, fever and chills, body ache, diarrhea and vomiting, and sudden or new loss of taste, sense of taste and smell. So those are the common symptoms of coronavirus, and it shows usually the symptoms or the signs and symptoms appears within 2 to 14 days after the exposure. In case that you are feeling like shortness of breath, heaviness on the chest, or any chest discomfort, there is a confusion. If you notice that your loved one have a new symptom of confusion or whatsoever, it is better to call our hotline, the 16000 here in Qatar, to ask more about the signs and symptoms, and for you to be guided accordingly. But if you manifest like shortness of breath, chest discomfort, severe headache, or severe symptoms, might as well submit yourself to the hospital or to the clinic within your area. So who among are the vulnerable population? So people the older population, basically. The older, like 60 years and above, and those with underlying medical problems such as hypertension, heart and lung disease, diabetes, obesity, and cancer are have the higher risk of acquiring such disease. However, anyone can get sick with COVID-19 and become seriously ill or die at any age. So we have rare cases of younger population being sick or died because of this COVID-19. So next slide, please. So that is what also the World Health Organization is. So how COVID-19 spreads? So COVID-19 spreads easily from person to person. Okay? Person to person through it most commonly spreads during close contact. That is why we are emphasizing the social distancing. Okay? Kasi minsan nakakalimutan, bakit po magso-social distancing? We are, magkasama naman kami sa bahay or magkasama kami sa trabaho. Still, since this spreads easily from person to person, we have to follow the social distancing of 6 feet or 2 meters, okay? To lessen the direct contact from a person to a person. And since its transmission is droplet, it is it ranges like from that specific range also, like 2 meters or 6 feet, like that. So better yet, you really have to have a social distancing. And then COVID-19 can sometimes be spread by airborne transmission. That is why they said that this new variant is being spread through airborne transmission. So is this really true? So actually, if this droplet became a tinier version of it, so it can possibly transmitted through air, especially if you are in a close area, okay, so that doesn't have or enclosed spaces that doesn't have adequate ventilation, so like if there is a negative pressure like that. So it spreads commonly through contact with contaminated surface. Yes, that is why we are emphasizing the hand hygiene. So before touching anything, you should wash your hands. But according to studies, there is less common that someone is affected or someone will be infected with COVID-19 after touching a contaminated surface. But still, again, we have to follow the proper hand hygiene. So COVID-19 rarely spreads between people and animals. So sometimes animals can get COVID-19 because they are very exposed to people infected with COVID-19. But there are very low or very rare cases that vice versa, animals will cause or will be the reason of the spread of COVID-19 to people. So next slide, please. So reinfection with COVID-19, like any other viruses, so reinfections are expected with COVID-19. That is why the CDC and the WHO are really monitoring the cases of reinfection. So, and according to them also, the routine is just the same. The treatment will be the same as this based on the world's protocol. So next slide, please. So these are the ways to prevent transfer or acquiring COVID-19 from others how can we protect others and ourselves from COVID-19. But to give us more in-depth uh, presentation on this is I think the speaker after me. So when you have a symptom, when should you be tested for COVID-19? Again, anyone with symptoms should be tested wherever possible. So if you have the symptoms that I have mentioned, so yes, better yet for you to have your swab or the PCR to the nearest health center. And if you are showing symptoms and still waiting for the test results, better yet, isolate yourself from others, okay? So let's all be responsible of isolating ourselves if we are feeling any symptom. And we have the 3 types of tests, okay? So we have the PCR or the usual swab test that we have. So here in Qatar, we are receiving the results are being received a day after the swabbing. The other one is the serological tests or the antibody test, which is you are getting a blood sample to have to know. Actually, this is not a diagnostic test for if you are positive or negative of COVID-19. This test, the serological tests and antibody test, is being used for us to know if we are previously exposed, meaning just an exposure to COVID-19. Still, we have to have the confirmation test through by PCR and the rapid antigen test that is we are using now. So yes, the COVID-19 update. So next slide. In the Philippines, for you to have, I have here some of the photos or pictures of the latest update. Yesterday, this was yesterday from the Philippines, the total numbers of infected, the people who died. So the updates basically on the Philippines. The next one is the update from Qatar. Yes, so for the Philippines, since Sir Henry have like what Sir Henry have said, so we really need to follow the reliable sources. Okay, so for the Philippines, I got the update from the Department of Health Philippines, and in Qatar, the Ministry of Public Health Qatar, and in the world, the World Health Organization. Okay, so for the world, they have this dashboard wherein you can see the real time update of the status of COVID-19 in the world. So it's covid19.who.int. So I know this gives a large number, a huge number, but at least we have a background or we have an idea of what's really happening in the Philippines, in Qatar, and around the world. So yes, I think that's it for my topic for today. Thank you for your time, for sparing your Friday with me. So have a good day and stay safe. Thank you.
All right, thank you very much, Ms. Vesa Lara Malain Raga, for informing us about COVID-19, for refreshing us on those matters, as well as regarding the update. Thank you. So just one question, Ms. Vesa. Okay, regarding the new variants, is there anything that, any comment regarding the new variant for our fellow Filipino community?
With regards to the new variant, no, again, these are just based on the studies, of course, that we have to really observe again the precautionary measures. Yes, it is natural for us to feel the anxiety, the fear of knowing na merong bagong variant na naman ng COVID-19. But still, it's really up to us. Have to be responsible of of practicing the precautionary measure and observing it religiously, as they say. So that's it. And I am not pro or against the vaccine, but I encourage everyone to have the vaccine, since the World Health Organization claims that the vaccines that we have in the country are effective to prevent the for you in
COVID-19.
COVID-19.
Right.
Yes.
Well, yeah, thank you, Ms. Vesa, for that wonderful discussion. And I know those kind of your additional discussions will be discussed by our next speakers. So to
Yeah.
formally appreciate your discussion, let me welcome Ma'am Rose to please award the certificate of recognition to Ms. Vesa Lara Malinraga.
Hello. Yes, let me read the citation of the certificate. Philippine Professional Organization Qatar, in coordination with Bayanihan and Hero Qatar, award this certificate of recognition to Ms. Vesa Lara Malain Raga, Secretary, Philippine Nurses Association Qatar, in grateful recognition and recommendation for her invaluable efforts and exemplary performance as a resource speaker with the topic, The Basics of COVID-19 Then and Now. During the Together Against COVID-19 webinar, given this 12th of March 2021, signed by Mr. Jerry Ronquillo, President, Bayanihan, Qatar, Engineer Adonis Talabo, PPOQ Chairman, and Mr. Henry Dimaano, Chairman Emeritus, Hero Qatar. Thank you so much, Ms. Besa.
Thank you, Ms. Rose.
All right, congratulations, Ms. Vesa, and thank you very much for sharing your expertise with regard to our topic, COVID-19 then and now. Well,
Yes,
at this juncture, yes, thank you. At this juncture, we will be learning about how to safeguard ourselves and our family members with this kind of pandemic. To welcome us, our next speaker, let us welcome the president of the Filipino Dentist Organization here in Qatar, Dr. Christian Marvin A. de la Cruz, to introduce our second speaker. Dr. Christian?
Yes, thank you, Sir Peach, for a very brief introduction. Anyway, our next speaker, she hailed from Zambales, Philippines, and a registered respiratory therapist under PRC. She's been an OFW for 16 years of the current and being 21 years in service as practicing respiratory therapist. She is an active member of Filipino Association of Respiratory Practitioners in Qatar since 2015 and a core member of Education Committee. Aside from being a healthcare frontliner, she is also an entrepreneur. Currently, she is the respiratory in charge of Al Ali Hospital. And without further ado, ladies and gentlemen, let's all please welcome Miss Cecil Grace Bakial.
Hello po, good morning. Good morning po sa lahat. Thank you for your introduction, Dr. Engineer De La Cruz. Okay. Maraming salamat po sa oras ng inyong ibinigay, lalo na po dun sa ating mga attendees. So magandang umaga po sa inyong lahat. Ganon din po sa ating butihing Consul General, si Sir Russell Reyes at ang ating pong mga panelists at ang ating mga attendees. So before I start po, I have no conflict of interest on this presentation, and the sources po that I use for my slides are from CDC, WHO, MOPH, and HAMAD po. Okay, so let's proceed po for the first slide. Hello. Hello po. Okay lang po ba na ako na po yung mag-share ng slides?
Sige po.
Okay. Share screen.
Yes, please do po. It's okay. Thank you.
Okay po. Okay, before I proceed po, let me just give you a brief information regarding Philippine Association of Respiratory Practitioner here in Qatar. It is a non-profit organization founded and inaugurated last 2015 with 100+ members from different facilities here in Qatar. An active member of Professional Organization Qatar through Polo OWA, and recognized by ARCPP, a member of the accredited and the Integrated Professional Organization of PRC. And the mission of the organization is to promote a high quality services in line with our profession as respiratory practitioner, where the community is the best beneficiary. While the vision naman po is to recognize national and international organization of respiratory care practitioner that promotes professional excellence and function as a proponent for patient, family, community, and the profession of respiratory therapy. Okay, next slide po. What is the role of respiratory therapies in COVID-19? So marami pa po sa atin sa Filipino community ang hindi nakakaalam kung ano po ba itong profession na respiratory therapies. Okay, respiratory therapies or RTs is an allied health professional that provides care for patients with cardiopulmonary diseases, including asthma po, emphysema, or mga COPD, pneumonia, o for short po, mga lung diseases kung saan pinaprevent po niya na makahinga o huminga on its own yung ating mga pasyente. And RTs have been playing a major role in treating hospitalized patient with COVID-19. So when COVID gets severe, lumala po siya, it evolves into acute respiratory syndromes or ARDS. Ito po yung iniiwasan namin, all right? One of the most complex ventilation problems that artists encounter every day. So we are all familiar po that COVID-19 can cause vomiting, fever, and headaches. So if this virus primarily affect the person's lungs, kung kaya naman po respiratory therapies are involved with every COVID patient that is hospitalized, because patient po can become so sick in a matter of hours lang. And once that happen, ventilators must be programmed to the individual needs of each patient. So itong mga ventilators po na to, ito yung mga artificial lung or mga breathing machine na ikinakabit sa pasyente na wala po silang kakayahan na huminga para sa sarili nila. And artists understand how to keep patients breathing. They are skilled in how to manage modern mechanical ventilators that have as many as 15 to 20 po na modes of ventilation. So why is it important to safeguard yung ating sarili, yung ating pamilya, and even the community against COVID-19? Simple lang naman po ang sagot dyan. Kailangan po kasi natin i-safeguard to help lessen the spread of the new coronavirus, which meron na tayong additional na tatlo pa na variant, which is the UK, South African, and yung Brazilian, and yung original na COVID-19 na virus. The diseases it causes, all right? So here are the important ways on how we can protect ourselves and family as well as community. So according to CDC po, meron tatlong importanteng paraan to slow the spread of the virus. Unang-una is to wear masks to protect ourselves and others as well. Everyone at the age of 2 and older must wear masks in public places, kung saan because of COVID-19 nagkaroon tayo ng bagong the new normal, at kasama dyan yung pagsusuot ng mask paglabas ng ating tahanan, not even paglabas kahit sa loob pala ng ating tahanan. And mask should be worn in addition to staying at least 6 feet apart, especially dun sa mga tao po na hindi natin kasama o nakatira sa iisang bubong, all right? And if someone in your household is affected, so people in that household should also take precaution, including wearing masks to avoid the spread to others. So hindi lang siya sa labas ng bahay, sa loob din po pala. And we have to frequently wash our hands or use hand sanitizers before po tayo maglagay ng mask, alright? Wear your mask over your nose, so sa ibabaw ng nose, hindi po sa ilalim, and mouth, secure it under your chin. Marami po kasi dahil nga sa hindi sila sanay sa pagsusuot ng mask, nilalagay nila sa ibaba ng ilong, okay? And fit the mask snugly against the side of your face or itali po sa likod ng ating mga ulo. And if you have pag palagi nyo pong ina-adjust yung inyong mask, meaning to say, hindi ito fit sa inyo. So you might need to find a different mask type or brand para po naman maprotektahan ng ating mga sarili, and make sure po, pag gumamit kayo ng mask, ay nakakahinga kayo ng maluwag. Ito yung number 1 na complaint po ng nakakarami when wearing mask. Okay? So according po sa CDC, there are face mask do's and don'ts. So nakikita nyo po sa inyong mga screen ngayon kung paano ba yung proper way of wearing mask. Katulad ng sabi ko nga kanina, it should cover yung inyong nose at lapat siya dun sa baba. So wag po nating ilagay sa liig, okay? Or ilagay sa ilalim ng ilong. Kailangan po nakatali din yung sa lower part, sa may chin. Iwasan hawakan yung mask. Wag ilagay sa ulo or ibitin sa leeg or even sa elbow. So after po nating i-dispose yung ating mga mask, make sure na kailangan nating maghugas ng kamay or we have to sanitize our hand. Okay, so the second way is we have to stay 6 feet away from others. So sa loob ng ating tahanan, avoid close contact with people who are sick. So if possible po, we have to maintain 6 feet between the person who is sick and other household members para po hindi na kumalat pa, okay, or magpasa-pasa pa yung spread ng virus. At sa labas naman po ng ating mga tahanan, we have to put 6 feet of distance. Kailangan po natin itong i-practice. Okay, put 6 feet of distance between yourself and the people who don't live in your household. So lagi nating tandaan po na kahit walang signs and symptoms, pwede pa rin po siyang makapag-spread ng virus. Pwede siyang maging carrier. So always stay at least 6 feet or 2 arm lengths from other people. Pag nasa labas po tayo, we have to keep distance from others, especially very important po dun, lalo na sa mga taong who are higher risk of getting very sick or mahawa, okay, yung may mga comorbidities. So according to CDC, there are key times to practice social distancing, hindi lang sa labas ng ating tahanan, kung hindi sa loob din po pala. So 6 feet po yan or 2 arms length. And third po, according to CDC, is to avoid crowd or being in crowded places such as mga restaurants po, mga movie house, yan. So the more po na pumupunta tayo dito, we put ourselves at higher risk for COVID-19. So avoid poorly ventilated spaces, and at the same time avoid indoor spaces that do not offer fresh air from outdoors as much as possible po. Kung nasa indoors po tayo, kung pwede po nating buksan ng mga bintana or windows, much better po. Okay? So according to WHO, there are 3 C's to avoid. Unang-una po is the crowded places, the close contact settings, and the confined and enclosed spaces. Kasi once na mag-meet po itong tatlong to, the risk is higher in places where these factors overlap. So the more tayong mas madaling mahawa, okay? So even as realistic, restrictions po, not only sa Philippines but also here in Qatar are lifted, we should also consider where you are going and stay safe by avoiding these 3 C's. Kung wala naman pong importanteng gagawin sa labas, so might as well stay home na lang po. Alright? Then according po sa ating sa government po, sa MOPH and HAMAD po, HMC, there, to protect ourselves and others. So as much as possible, iwasan natin ang friends gathering, funerals, family visit, and even yung sa mga prayer sa mga masjid. Ano? Ngayon, friends and gatherings, there are directive from the government of Qatar na 15 hanggang 15 lang. Pero kung pwede naman natin itong iwasan, why not? Kaya nga po na-create under the new normal yung mga webinar, yung mga Zoom meetings kung saan pwede pa rin tayo makipagkamustahan sa ating mga kaibigan at mga pamilya na malayo po dun sa risk of getting this spread of virus. Now, there are also additional ways to slow the spread. Including po yan, wash your hands very often. Ito po, maliit pa lang po tayo, no? Tinuturo na ng ating mga magulang. Okay, wash your hands with soap and water for at least 20 seconds po yan para siguradong tanggal yung mga kumapit po na mga virus or dumi sa ating mga kamay, no? So after nating gumamit ng mga public places, after nating mag-sneeze, after umubo, okay, maghugas po tayo ng kamay. Then, sabi sa atin ng ating mga magulang, maliliit pa lang tayo, before eating and preparing food, kailangan maghugas din ng kamay. So, nauulit lang po. Ang kailangan po natin is adapt at i-practice. So, after touching your face, using a restroom at yung pag-alis sa mga public place po, no? And handling mask, changing diapers, or pati po yung pag-aalaga sa ating mga may sakit. At after touching animals or pet, we have to wash our hands. And in case po na soap and water are not readily available, meron naman tayong mga hand sanitizer na pwede nating pangpalit sa soap and water. But make it sure na itong hand sanitizer po natin ay at least 60% or it contains 60% of alcohol. So you have to cover all the surfaces of your hand and you have to rub them together and let it dry. So wag pupunasan, okay? So useless kasi pag naglagay ng sanitizers then pinunasan mo. So wala din pong effect yon. And avoid touching your eyes and nose as well as your mouth with unwashed hands. Okay? So nakikita po natin dito sa ating mga screens na may nilabas na guidelines po ang MOPH and HAMAD on how to hand wash properly. Sabi ko nga, it should be 20 seconds. So kailangan po pala, once na nabasa ang inyong mga kamay, put sa soap, enough soap, rub po yan, ganyan, palm to palm, interlace po, okay? Right and right over left and vice versa. Pati po pala yung palm to palm natin, kailangan pa ganyan, maliban pa po sa ibabaw, ganyan. Palm to palm, pati yung dulo na yung tips ng ating mga daliri, yung thumb, okay? After po nito, then you have to rinse hands with water at kumuha po ng towel, okay? Or ng tissue to dry our hands. But pagdating naman po sa pagsara ng faucet, you can use another tissue po or yung paper towel or you can use your elbow to close yung faucet. And remember, you have to save water as well, all right? So to continue po. Another way to slow the spread is cover during cough and sneeze. Ito po matagal nang naman tong ating tinuturo sa atin, but nakakaligtaan po ng nakakarami. So always cover your mouth and nose with tissue. Okay, kung hindi po available ang tissue, pwede po yung sleeves ng inyong mga damit or yung elbow po ninyo at iwasan po ang pagdura. Okay, pag after gamitin ng tissue, make it sure itapon kaagad sa basurahan. Huwag na pong ilagay sa bulsa or ilagay po sa ating mga bag kasi kung yan po ay infected o kung kayo man po ay infected, so instead na ma-stop yung spread, umuulit lang ng umuulit. Alright? And immediately wash your hands pagkatanggal po or pagkatapon ng tissue, wash your hands with soap and water or alcohol sanitizers. Alright? So according to CDC, to stop the spread of germs, you have to cover when you sneeze, cover your mouth, your nose when you sneeze or when you cough, and throw your tissue immediately doon sa ating mga basurahan. Okay? So kailangan lang po natin itong i-adapt at i-practice, which is including po yan doon sa ating new normal, and at the same time, we have to practice po yung cough and sneezing etiquette. Again, you have to cover your mouth and nose with tissue, or kung may suot po ng mask, wag namang ibababa, saka uubo. Ubuhan nyo po yung inyong mga mask, okay? Then, kung meron po kayong extra mask na dala-dala, yung iyong pong naubuhan na mask, okay, itapon po sa tamang basurahan, alright? And magpalit po ng mask. But make it sure you have to wash your hands po muna or sanitize your hands bago po magpalit uli ng bagong mask. Or use your elbow to cover your nose and mouth when coughing. Sanayin po natin itong cough and sneezing etiquette po na ito. And we have to clean and disinfect. Regularly po yan, daily. Lalo na po yung mga surfaces na frequently touched. Nangunguna na po ang cellphone, lalo na ngayon sa generation natin. Majority po, they cannot live without cellphone. So ito po, isa sa pinakamarumi, alright, na gamit po natin, na inuuwi natin palagi sa bahay. So these frequent touch surfaces, kailangan nating i-disinfect, such as doorknobs, yung mga tables po natin, alright, computers, faucet, okay? So kung ito pong mga bagay na to, kung maruming-marumi sila, such as doorknobs, okay? Kailangan po muna natin silang linisin with soap and water prior to disinfection, okay? But yung mga cellphone, huwag naman pong pupunasan or lalagyan ng sabon, alright? Yung ating mga wipes po, alcohol wipe, pwede na yan, okay? Then use a household disinfectant. Use products from EPA list. Ito po i-click nyo lang to sa internet, itong mga EPA list na to, readily available po yan sa internet. Alright, so according to CDC, we have to clean and disinfect frequently touched objects and surfaces para naman po maiwasan ng kumalat pa ang virus ng corona. And the key times po is we have to clean and disinfect again your home. Daily po, may daily, okay, which is doors, tables, light switches, countertops, handles, even the desk, phones po, at even yung mga susi po natin. At if someone is at home is sick, okay, after they touch additional surfaces that someone else at home may touch, kailangan po linisan kaagad or i-disinfect po natin kaagad, okay? And lastly, we have to monitor your health daily. So be alert for the symptoms. Watch for fever. Unang-una po yan, fever, yung coughing. Kung hirap na pong huminga, nagde-develop yung shortness of breath, okay? Kailangan po natin itong i-monitor. So kung meron po tayong especially important if you are running essential errands po, going to the office and workplace, lagi po nating tatandaan, we have to monitor po and be alert dun sa mga simptomas. Kasi hindi po natin alam ngayon kung sino yung meron at kung sino yung wala. Lalo na tumataas po ang cases, alright? So we have to keep a physical distance of 6 feet or 2 arms length po yan. And in case po that symptoms develop, you must take your temperature, i-monitor po natin. But make it sure po na don't take your temperature 30 minutes within exercise or 30 minutes po after taking po yung mga medication that could lower the temperature. Okay? And follow the guidelines po of CDC, which is available po ito sa internet. I-click nyo lang po yung guidelines ng CDC, lalabas na po yan. Again, if you came from travel, you have to get tested 3 to 5 days or stay home and at least 7 days and watch for your health. But kung talagang kukontinue o lumalala yung inyong symptoms, lalo na po ang fever and coughing and difficulty of breathing, you have to ask medical attention na po. Alright? And lastly, get vaccinated to protect against COVID-19. So meron naman po tayong mga guidelines from Philippine government and Qatar government kung sino-sino po ba yung mga dapat ma-vaccinated. Okay, so ayan po. Dito na po yung aking last slides. Again, yung any details po, additional details when it comes to the vaccination will be discussed po by the next speaker. Again po, I'm Cecil Grace Bakyal. Okay? Thank you sa oras na inyong ibinigay po sa akin. But before I leave po, I would like to acknowledge, okay, the contribution that was given and the guidance po ng aming presidente, si President Gayson Pastoral, ang aming Vice Dino Marasigan, and ang aming Secretary po na si Miss Baby, and also yung head po ng Education Committee ng PhilArc, si Ma'am Jorna Regala. And also Centers for Disease. Okay, again, I'm Cecil Grace Bakyal. Thank you for listening po. At maraming salamat and good morning po ulit sa inyong lahat.
That was Mom Cecil Grace Baquial from the Filipino Association of Respiratory Practitioners in Qatar. Ma'am, thank you so much for your very informative discussion. I know that yung time natin is not enough to suffice sana yung learnings, but of course, at least somehow we have inculcated sa minds ng ating mga fellow kababayans regarding how to prevent COVID-19. Kahit sa simpleng bagay lang. Well, thank you so much, ma'am. That was really appreciated. So, ma'am, there is one question po just from our audience. Mabilisang sagot lang po regarding this one. So, if ever po na during work po, paano naman po prevent ang COVID-19 in terms of kung nasa work po tayo?
Kung nasa work po kasi, sabi nga po ng CDC, a guideline ng CDC, kailangan unang-una dyan is we have to wash our hands. Ganon lang po kasimple. Even before maliliit pa lang po tayo, tinitrain na tayo ng ating mga magulang. But because of our busy schedules, lalo na po nung nagkaroon ng pandemic, nakakalimutan na kasi sa dami ng ginagawa. Para itong simpleng gesture na to, washing your hands, can prevent or let's say prevent and slow the spread of the virus. Ano lang po, kailangan lang natin siyang sundin at i-remind at i-adapt po palagi kasi this is the new normal. We have to adapt for us to survive. So simpleng gesture po of washing your hands, okay? Follow po yung mga rules and regulation ng bawat health facilities and it will help you po na makaiwas doon sa COVID-19. Okay.
All right, thank you, ma'am. So, ganun pa rin, follow the protocols na sinasabi sa atin ng MOPH, ng CDC, ng World Health Organization, and just do our part in order for us to prevent this kind of situation na tayo affected by COVID. Thank you very much, Ma'am Cecil Grace Baquial. And to award the certificate of recognition, let me call in our technical director, siguro, Engineer Sherwin, to award this certificate of recognition to Ms. Cecil. Sir?
Hello, good morning, Ma'am Cecil. Thank you.
Yes,
And on behalf of the PPO, I would like to read the certificate. The Philippine Professional Organization Qatar, in coordination with Bayanihan and Hero Qatar, award the certificate of recognition to Ms. Cecil Grace S. Baquil from the Filipino Association of Respiratory Practitioners, Qatar, in grateful recognition and commendation for her valuable efforts and exemplary performance as a resource speaker with the topic Safeguarding Oneself and Loved Ones During the Rise of Cases, during the Together Against COVID-19 webinar, given this 12th of March 2021, signed by Mr. Jerry Ronquillo, President of Bayanihan Qatar, Engineer Adonis Q. Talabo, Chairman PPOQ, and Mr. Henry Dimaano, Chairman Emeritus Hero Qatar. Thank you, ma'am.
Welcome po. Thank you rin po.
Thank you and congratulations, of course, Ma'am Cecil Grace Baquial. All right, now we have two more speakers left for our activity. So, ang next na speaker natin will talk about how we will be able to handle stress during these challenging times. So I know all of you are excited with this one. So to further introduce our next speaker, let me call in Engineer Jaime Fortaleza to introduce our third speaker. Engineer.
Good morning po sa lahat. Hello po, good morning. So,
yes, sir, good morning. Yeah.
Thank you. Thank you so much. So our next speaker is he is a registered nurse with more than 13 years of experience in mental health, active contributor in establishing the National Health Mental Helpline in Qatar, currently acting director of Nursing Education and Mental Health Services, HMC, former faculty of the College of Nursing, Our Lady Fatima University back in Philippines, former nurse licensure exam Senior Lecturer Reviewer. Please welcome Mr. Franklin Pineda, Acting Director of Health Education Mental Health Services, Hamad Medical Corporations, with the topics stress in times of pandemic. Welcome po, sir. Back to you. Thank you.
Sir Frank, you are muted po. Naka-mute po kayo. Ayan.
All right. Can you hear me now?
Alright, yes. Yeah, loud and clear po. Thank you.
All right. Thank you. Thank you, Peach. Thank you, Sir Jaime, for that introduction. And thank you to the Philippine Professional Organization in Qatar for inviting me in this webinar to talk about a very important topic. And that is about thinking about our well-being and looking at ways on how we can manage stress in this very difficult time. So, Pitch, can I share my screen?
Yes, sir. Do you want me to share your screen, or you would do that for yourself?
I'll do that. I'll do that. I'll manage.
Okay, sir. Yeah. So while waiting for Sir Frank to share his screen, let me remind everyone, should you have any questions, just feel free to post your questions in our question box, and we will be reading it after. Thank you. So let's welcome again Mr. Frank Pineda.
Can you all see my screen now?
Yes, sir. Please proceed. Thank you.
All right. Thank you. So, like I said, today I was tasked to talk about a very important topic. It's about thinking about your well-being. Since the outbreak of the pandemic last year, we have seen more and more people getting psychological and stress reactions because of the impact of the pandemic. So it's really important to think about how we can be resilient for ourselves, for our family, and our patients. And before I proceed, I just want to declare no conflict of interest in facilitating this session. In 2020, in October 10, 2020, we celebrated the World's Mental Health Day, and we had the theme of greater investment and greater access with mental health. Ibig sabihin nito, especially during this very difficult time, it's important to think about our mental health and well-being, because there's no health without mental health, and that is becoming more and more apparent, lalo nitong nararanasan natin yung tinatawag na second wave, and tumataas na naman yung numbers ng mga infected people. So it's really important to think about, how is this pandemic affecting me, right? If we are feeling stressed right now, that's okay. It's okay. It's normal. If you're scared, if you're anxious, if you're getting some stress reactions, that is really normal. Pero although normal siya, it's really important to acknowledge it. The first step is we need to acknowledge that I am not okay. That this pandemic, the situation, is really stressing me out, and that I am stressed right now, and that is a really important step para to start managing our stress, right? Kasi pag hindi natin na manage yung stress natin right now, although normal na magka-stress tayo ngayon, pag hindi natin na-manage yan, we can be vulnerable and at risk to developing more serious mental health problems. And yun ang main reason why I am here today. I would like to talk about the importance of preventing the development of more severe or more serious mental health problems. Last year, nilaunch din ng Ministry of Public Health with partnership with major health organizations here in Qatar, the Are You Okay campaign. Yeah, yung Are You Okay campaign na yan, it's a really great initiative because this Are You Okay, by asking people, are you okay? But by asking yourself, am I okay? By asking your family and friends, are you okay? That is a good conversation starter to talk about mental health. By asking people, are you okay? We will be able to make it easier for people to comfortably talk about. And we all know, I'm sure all of us in this webinar today have our own share on on some stressful situation related to the pandemic. So it's as easy as asking yourself, am I okay? And asking your colleagues, your family, your friends, are you okay from time to time? I'd like to talk about why this pandemic is causing stress, right? And what is the impact of this pandemic? One is, since the outbreak of this pandemic last year, na-announce na mayroong pandemic, na nagkaroon na ng mga lockdowns and all, the entire world has been struggling to balancing health protection, minimizing economic and social disruption, and respecting human rights. So, ito yung mga dilemmas. So, kinakailangan dapat we need the previous speakers were very vigilant in talking about the infection control precautions. On the other hand, because of those restrictions related to and to impose and implement this infection control precautions, it has greatly affected lives and industries, right? So, for example, tignan yung mga restaurants, for them to facilitate those restrictions, those infection control, konti lang yung pwede nilang i-accommodate sa mga restaurants nila. So, to mga businesses, very minimal, at 15%, at 30%, at 50%. And that has significantly affected the world's economy. Maraming negosyo ang nagsara, maraming tao ang nawalan ng trabaho and we continue to see that. We continue to experience that unfortunate turn of events. Pero that it is crucial these restrictions to happen to make sure na maprotektahan naman yung public health, right? We cannot minimize and discount that there are compromises, and unfortunately, it's a serious compromise. And the other thing is respecting human rights, diba? We have the rights. Since the pandemic, because of these restrictions, a lot of people have and there have been controversial claims and controversial discussions and debates on how these restrictions are human rights. Pero it is not in the ideal world lang mga ganito, di ba? Pero what's happening now is far from ideal. Our reality right now is we have this serious virus, infecting and affecting the entire world, and we all of the decisions that we make for our health affect the health of other people. So this is a critical dilemma that the entire world is facing. There has been significant strain on healthcare resources, and marami tayong mga healthcare professionals dito that I know they could relate. A lot of people have been redeployed from one area to another area. Some people have been asked to start functioning and serving roles that they've never performed in the past, because again, this is a pandemic. And but ang nakaka-proud talaga sa ating mga healthcare professionals is and this is very significant and very evident, na makikita natin na lahat ng mga healthcare professionals, especially the Filipino health professionals here in Qatar, have stepped up. The world has called for us to step up, and we deliver, and we continue to deliver, and nakaka-proud lang talaga yon. Pero there are significant strain on healthcare resources, and the other thing is that I would like to focus on today is to increase more and more, like in mental health services. towards the end of last year, we have 30% surge increase in people accessing the mental health services. Later on, I'll talk about the National Mental Health Helpline, and we are getting more than 100 calls of people with varying experiences and their shares on being psychologically distressed. Pero bakit ba tayo nagkakaroon ng mga stress reactions? A very common one is the uncertainty of what's happening. So although isang taon na yan, the information that is being received and perceived by the public is varying from one person to another person. No, the internet has been very helpful in keeping us all informed about what is this virus all about, paano tayo makakatulong. However, it's been both a gift and a curse because hindi natin alam kung gaano ka-reliable yung source of information na kinukuha natin, and sometimes too much information is stressing people out. Kanina yung mga past speakers natin has been very specific about their sources of information, CDC, WHO, MOPH, Hammond Medical Corporation, na alam natin na all of these sources are evidence-based. They offer evidence-based information. However, the general public may not be able to access. Baka yung general public, baka yung source of information nila, yung mga status sa Facebook, yung mga nakikita natin sa YouTube, and that has been causing a lot of stress din sa mga tao. The other thing is people haven't been traveling. There have been travel bans, and that has stressed a lot of people, and that is totally understandable. If you look at the literature, the greatest up until the end of 2020, the most important and most significant protective factor, against any mental health problem is connection, social connection, connectedness to family, connectedness to friends and colleagues. And although meron tayong we can take advantage of the social media platform to still connect, the human element, the human touch is lost in this type of platform, and that has significantly, inevitably affected people's mental health. Meron pa na so isang taon na. So if you think about last year, lahat tayo inisip natin, alright, matatapos na to. Pag dumating yung vaccine, okay na tayo. And now, meron na tayong vaccine, pero kinakailangan pa rin natin mag-follow ng safety precautions. May mga travel bans pa rin. We still don't know when are we going back to normal, right? So can we still go back to normal? Or how about adjusting to the new normal? And what is that new normal? And this is very relative and subjective. And a lot of people are struggling on how to adjust to this new normal. And today I'd like to talk about how is this all affecting us. So I have here a stress performance curve just to illustrate and give you a preview on how stress affects us. So you can see here, you have the green zone here, and you have the red zone here, right? In this axis, this would indicate our performance, and this is the stress level. Kung makikita nyo, dito sa sa green zone na to, this is when you have the stress level at its lowest, right? So think about pag chumichill ka lang sa bahay, nanonood ka lang ng Netflix, nakahiga ka lang during your vacation. If you think about during that time, you don't wake up early. You just chill, or dito tayo nagka-couch potato, which is okay, as a part of relaxation. But in terms of productivity, in terms of performance, less stress, having no stress would only make us inactive, right? So kung makikita nyo dito, habang tumataas yung stress, nag-o-orange siya, nag-yellow siya, nag-orange siya. Habang tumataas yung stress, pumipik din yung productivity natin. So this only goes to show that stress is really helpful as well, right? So stress is not all evil. You know, stress has always had this bad name na masama yung stress. But in fact, okay yung stress. Importante din yung stress. If you think about our the hand washing routines and habits that we have developed because of this stress, right? So in the past, for sure sa ating mga sa ating mga kababayan diyan, makaka-relate kayo. In the past, pag kumakain ka ng chips, nahulog yung chips, kumakain ka ng manok, nahulog yung balat ng manok, kukunin mo pa, kakainin mo pa, wala pang 5 minutes, pwede pa, safe pang kainin yan, right? Kasi wala tayong pandemic eh. So, pero ngayon, when that happens, you won't even think twice, you will not get that, right? You've seen people, even children, right? Even children, hugas ng kamay, konting hawak dito, alcohol ng alcohol, which is good, right? And itong pag-alcohol na to, itong mga hand rub, itong hugas tayo ng hugas ng kamay, pati groceries natin, pinupunasan natin, for sure, for the past years, ngayon naging pinakamalinis yung bahay natin, tsaka yung surroundings natin. And it's all because, it's all thanks to the stress that we are experiencing, right? So there's really good things about stress. This stress has kept us safe as well. Kasi it is because of this stress that made us very vigilant in following these safety precautions and infection control precautions. On the other hand, whenever we're stressed, it's important to recognize na sobrang daming nangyayari sa katawan natin. Kumbaga, there's a sudden surge, sumasabog sa loob ng brain natin, ng katawan natin, a lot of hormones and brain chemicals. And what it does is it puts ourselves in a fight and flight response. That means tumataas yung adrenaline mo, tumataas yung cortisol levels mo. So you feel you're always on the edge, right? So on some levels, okay yun. On some levels, nakakatulong yun. It helps us perform well. On the other hand, kung araw-araw ganun ang nangyayari sa katawan natin, our body, our mind can only take so much. And what happens is, by nature, normally what would happen is our body would adapt and adjust, but it can only adapt and cope for so much. And once it loses the ability to adapt, what happens is we start coming through and going to this red zone wherein nakaka-experience tayo ng fatigue, stress overload, exhausted. Dito na yung nafe-feel natin, burnt out na tayo, na kahit na parang ba't ngayon ayaw mo na lumabas ng bahay, ba't ngayon ayaw mo na sumama sa mga kaibigan mo, right? So if you think about that, na kesa sa lumabas ako this weekend, itutulog ko na lang, mas madaling, that's easier. It's easier to make a decision na I'll just chill, I'll just watch Netflix. Pero until such time na mapapansin mo na for a few months you haven't seen your friends, for a few months you haven't gone out with your friends, you haven't engaged in a social act. And unfortunately, pag tumagal yan, people can start manifesting symptoms of anxiety problems, symptoms of depression, right? And once we get into this part, mas mahirap nang bumalik dun sa green zone, right? So all I'm saying here is, from every day, from time that it's okay to go to the red zone. Pero ang importante ngayon, what I would like to talk about today is, what are the practical things that we can do in our daily lives para every time, although pupunta tayo sa red zone, maya't maya babalik din tayo sa green zone, right? So those are the things that I would like to talk about today. The other thing is, it's really important to perform self-check, right? So sabi ko kasi sa inyo, di ba, yung pinakita ko sa inyong slide kanina, are you okay campaign. So from time to time, so on one hand, it's okay not to be okay, right? But from time to time, also ask yourself, am I okay? Ask people around you, are you okay? right? Now, how do you know that if you're not okay anymore, right? So, so these are the stress warning signs. So, ito yung the way I present this, ito yung pwede nyo gamitin as self-check. Am I already experiencing a stress reaction? Am I already experiencing psychological distress? So I'd like you to think about what happens to your mind, what happens to your body, what happens to your emotions, what happens to your behavior as well, right? So first, what happens to your mind? So kumusta yung concentration mo? Kumusta yung memory mo, right? Kumusta yung mga decisions mo lately, right? Are you able to relax, right? If you feel na for the past 2 weeks parang hindi ka na makapag-focus, for the past 2 weeks hindi ka na parang may nalilimutan ka, you cannot concentrate, you know, and it has already started affecting your activities of daily living. And that could be a sign that you are experiencing a significant stress reaction. Let's talk about how you feel, right? So kumusta yung mood mo, right? Every day when you wake up, how do you feel, right? When you get out of the bed, when you go out for a run, when you go to your work, pag uwi mo, how do you feel, right? Nagbabago ba? Kasi importante dapat nagbabago yung emotional state natin. For example, pagising mo sa umaga, of course, you feel flat, you feel blunt kasi nga gumising ka, yung mo pang bumangon. Pero after you take a shower, that should significantly improve your mood, right? Pero after taking a shower, after walking around, after maybe walking a dog, or going for a short walk or run, walang nangyayari sa'yo, walang nangyayari, hindi na apektuhan yung mood mo. You feel so low, you know? And that could be an indication that you're you're experiencing an emotional distress. Kumusta yung pagtrabaho mo? Do you feel, although alam natin, sabi natin stress, okay lang yan, di ba? Normal yan. Pero do you feel overwhelmed? To feel overwhelmed over many tasks, that's okay. But if you feel overwhelmed every day, that's something else. If you feel overwhelmed for the past few weeks, that's something else. Kasi you know yourself, right? That's why I call this the self-check, because all of us, we know ourselves, we know our baseline, our normal, right? So if you feel there are significant changes in the way you think, the way you feel, there might be some issues with stress reactions. How about physical symptoms? You know, ang mga taong stress, laging may headache. Ang mga taong stress, maraming aches and pains, may mga GI disturbances yan. May mga people who are experiencing a panic attack will experience the exact signs and symptoms of a person experiencing a myocardial infarction, right? So some breathing difficulties as well. And then behavioral symptoms, tignan mo, mas kumakain ka ba ngayon or less? Kumusta yung tulog mo, right? And then how are you doing with socializing, with connecting with your family and friends? Are you still able to do that? So feeling natin pagod lang ako, okay lang ako, pero again, from time to time, perform a self-check. How many times have you refused to decline the invitations of friends and family, right? When was the last time you chat, you talked to your family? When was the last time you dined out, right? Kumusta yung tulog mo, right? And I cannot emphasize how important sleep is, right? Sleep hygiene is really, really important, because sleep prepares us for the next day, right? A good sleep hygiene boosts our resilience, and it boosts our immune system as well, right? So kinakailangan we should be able to sleep, of course, on an average dapat 7 to 8 hours. Bata ka, matanda ka, kinakailangan 7 to 8 hours. Pero iba-iba yung ano natin, di ba? Iba-iba yung good sleep na tinatawag natin. So how do you know that you have a good sleep, right? So when you sleep, you need to make sure na pagising mo, assess yourself. Do you feel rested? Do you feel you have a clearer mind, right? if you feel rested, kahit 6 hours lang yan, maybe that's all you need, right? Pero minsan, kahit natulog ka ng 8, 9 hours, pero you feel restless, right? Kasi nga, yung quality ng tulog mo, 8 hours kang nakapikit, pero mayat maya nagigising ka, right? Pinipilit mo yung tulog mo. So, that can actually, that would itself increase your anxiety and your stress. And kung puyat ka, the next day pumasok ka, mas vulnerable ka sa stress. So, these are very easy guidelines to help you assess yourself or assess a person you love or your colleague. Yeah. So I'd like to talk about well-being. I'd like to talk about resilience, right? So ayoko ma-burnout tayo. Let's not go to a point na ma-burnout tayo. Ang gawin natin, let's think about our well-being and work on that well-being and promote, make sure that we have a really good sense of well-being for us to achieve resilience. So when I say resilience, that is our ability to bounce back from a stressful event, right? So because remember, stress, whether we like it or not, stress is one of the constant things in life, right? Whether you like it or not, stress will be there, right? And the only thing that you can do is how do you cope with stress? How do you bounce back from being stressed? And that is resilience, right? And well-being is about may problema ka man, may problema ka sa pera, may problema ka sa trabaho, may problema ka sa relationship, always ask yourself, do you have a general sense of being healthy and happy, right? So you don't have to be excited and kilig happy, right? But are you generally happy? Are you okay? Are you content with the where you are right now? You know, and that is really really important. Like for example, in my case, every time I feel stressed, I always practice gratitude. I always think that if I look at what's happening in the world, I am so grateful na nandito ako sa Qatar right now. You know, I have received my first dose of the vaccine, which I think would be difficult if I am somewhere else, right? Na I have a really good organization, ang ganda na health system dito, na to the kahit pag inisip ko na worst comes to worst, pag ako nagkaroon ako ng COVID, I know I will have a decent bed somewhere with skilled and with skilled health professionals. I know Hamad will take care of me, and I don't have to spend anything. You know, so when I think about that, you know, okay na rin kahit di ako makatravel, okay na rin. Okay na rin kahit ang daming restrictions, okay na rin, you know. So if you have a general sense of happiness, being healthy, that's well-being for you, right? Why is it important to talk about this? Importante, we need to support ourselves and other people as well. So I'd like to introduce to you the 5 ways to well-being. So I talk about making sure that we connect to people, we stay active, we take notice, we give, and we keep learning, right? So the first one is connect. Like I said, if you look at the literature, the most important, the most powerful and significant protective factor against any mental health problem, depression man yan, psychosis man yan, anxiety disorders man yan, is social connection with family, connection with friends. So it is important that you stay connected with the people around you, with the people that would provide you emotional and social and psychological support. And I know right now it's quite difficult. Kagaya ng picture na to, it's quite difficult to stay connected like physically, but just like what we're doing right now, you know, we can always connect virtually. I know you can argue that it's not that physical connection would still be preferred. I am sure, and I agree 100%. But connecting to people virtually is a really really good compromise. You know, na kesa sa wala, right? Building these connections will support and enrich you every day. It's really important that you talk. You know, if you think about our patients when they come to us in mental health, if you think about people who call us to the mental health helpline, a lot of them haven't been talking about how they feel. So when they come to us, all the interventions would revolve around how can we help this person to start opening up, to start talking about what's happening to them, because it is only by then that we can give them professional advice and facilitate psychological interventions. So if you're experiencing like with your daily stress, please make it a habit to talk to, when you go home. Don't avoid that. Wag nating ayong pag-usapan kasi nakaka-stress lang, right? Ang gawin natin, pag-usapan nga natin, because just by talking about it, just by talking about it, it would help us become more resilient. Hindi siya na-solve, pero nahihinga mo siya, right? And that is really critical. That's really crucial in ensuring and promoting resilience, your resilience, right? So connect with your friends, connect with your loved ones and your family. Be active, right? So be active. And I'm not talking about enrolling in a gym, paying 3,000, 5,000 for a gym membership na hindi naman sustainable, right? So think about what is sustainable for you, right? I have friends who are into gym. They can go to the gym every day. I tried that. Nag-enroll ako ng 3 months. Siguro pinasok ko lang maximum 1 month, right? Because for some people it works. For some people it doesn't. So try to explore how can I be more active, something sustainable. So maybe it's not going to the gym, but maybe it's about start a 10-minute walk, 15 minutes walk, right? If you look at the literature, para daw maging exercise, physical exercise, yung walking, you need to have at least 30 minutes of walking, brisk walking for at least 3 times a week. So kung hindi mo kaya yun, let's start with 10. Baby steps are better than nothing, right? If it is about kung nasa bahay kayo, yung mga kababayan, yung mga nanay diyan, mga tatay diyan, wala kang time mag-exercise, play with your kids, throw them about, makipaghabulan ka sa mga bata. And I'd like to invite all of you to notice the changes, in your mood when that happens, right? The other thing is take notice, right? It has been so busy, it has been so stressful that we have been focusing on what's happening inside my brain, right? Yung worries natin, pupunta tayo sa park, kakain tayo sa labas, we'll hang out with friends, nasa phone tayo, nagtitingin tayo ng mga statistics or what, right? And one of the most important, and there's growing evidence around this, taking notice, not experiencing what you have. So when you go to the park, take notice the greeneries, right? Take notice of the birds, the people walking. Take notice of how you feel with how the wind touches your face. Take notice of the sound of the birds chirping. How does it make you feel? It's all about savoring the moment, and that by doing that, by focusing on what's happening in your real world, that would distract us from exploring and really being fixated to the worries of our lives. And then keep learning. Importante to, keep learning. Try something new. Ang daming naging mga plantita ngayong in this pandemic, and this has really helped people, engage, and be productive. Try to think about revisit an old passion of yours or develop something new. For me, I've started learning about food photography, and I'm starting, but it's something. It's really important that you distract yourself into something productive and give. Be kind to yourself. Be kind to other people. It is when you give, whenever you give, you are doing the right thing, and that the effect of that to your mental health is really powerful, because what happens is you get this sense of fulfillment that you are doing something good. The good thing about that is, if we relate natin sa pandemic ngayon, pandemic, wala kang magagawa dyan. Kailan matatapos to, wala kang magagawa. But by doing something for others, ito, kontrolado mo to. I cannot control the pandemic, but I can control what I can do for other people, right? And then finally, think about your diet. You know, I definitely I'm not a role model on this, right? Pero okay lang from time to time. Let's go crazy with talabat, right? With deliveries. Pero think about ngayong araw na to. Siguro hindi ko kaya ng gulay pero may siguro imbes na mag-burger and fries ako, burger na lang ako, right? Or konting gulay naman dyan o konting prutas naman dyan from time to time, right? Something really, really sustainable. And ask for help. Ask for help. When all of these things that we're talking about don't work, ask for help because help is available. We have the National Mental Health Helpline. Please call 16,000. You know, this is a group of mental health professionals. We have mental health nurses, psychologists, and psychiatrists, occupational therapists, speech therapists, and this is free of charge, right? And all the calls are anonymous. So whenever you feel hindi mo kaya, parang feeling mo stress ka, tawag ka ng 16,000, press 4 for mental health support. This is not, all of the conversation would be anonymous. You don't even have to tell your name. They will not collect your HC number, right? Pero this may actually provide you an opportunity to talk to a mental health professional. And finally, I'd like to thank everyone, you know, all of our health professionals out there who have been working so hard, extra shifts, you know, doing extra things to contribute in this in this pandemic. You know, not all superheroes wear capes. Sometimes they're doctors. Sometimes they're occupational therapists. Sometimes they're nurses. Sometimes they are respiratory therapists. Pero I think all of you have been really have been superheroes during this pandemic, and I can only thank you in behalf of Mental Health Service. Thank you.
All right, thank you so much, Sir Frank, for your discussion. Yeah, I really would like to reiterate what you have said, that we may not be able to stop the pandemic, but we are capable of doing something during this pandemic. Thank you so much. Well, actually, sir, this discussion mo, if ever we are stressed, what I usually do is just to deep breathing exercises. Okay, but thank you for sharing as well the 5 tips. Sabi mo that we have to be curious, we have to give notice, we have to keep learning. Okay, so mga ganung bagay. I think, sir, we have some questions here for you. Just a very very brief ano lang. In terms of between male and female po, who do you think is more affected with the pandemic in terms of stress levels? Just an observation, or maybe if you have evidence-based literature, that would be great as well.
Yeah. Thank you for that question, Paige. If you look at the literature, it has the literature has been consistent. Na in terms of mental health problem, mas vulnerable yung females, right? Females in terms of developing it, you know, kasi and diagnosing it and identifying it, you know, mainly because women by nature, you know, are more expressive. So it's easier to diagnose them. It's easier.
Okay.
They ask for help right away. Unlike for us, you know, unlike for us,
tinatago eh.
tatago muna pag di mo lang kaya tsaka sasabog, right?
Sige po, we have a caller here from Miss Gretel. Miss Gretel, you are now recognized. Please unmute yourself. She will be asking a question.
Okay.
Ma'am Gretel, you are now recognized. Please unmute yourself and you may ask your question. Yes, you are in the line now. Thank you.
Good morning, Sir Frank. This is Gretel.
Hi, Gretel.
Yes.
Like what
Putulat ang linya niya.
Gretel, please unmute yourself or forever hold your peace.
Okay, sir, basahin ko na lang po yung question niya kasi nag-message pala siya dito. Okay. If someone po already is having a pre-existing mental health condition, for example, no, how can they protect or promote their mental health well-being? So, paano nila ma-improve yung mental health well-being na considering na may pre-existing na?
Oh yeah.
What can you recommend?
That's a really, really good question. Di ba, ang sabi ko sa inyo kanina, it is already established that no one is immune to stress.
Yes.
The same way na that stress is the major contributing factor to developing any mental health problem, right? So all of us here, as we talk, walang immune to developing mental illness. If you look at the literature, according to WHO, one in 4 adults, right, is experiencing a significant depression or anxiety problem. So, ilan ang tao ngayon dito? 100 something? 100?
Yes,
Around 100? So, it could well be that 25 people here as we speak sa atin dito are experiencing anxiety and depression that they do not recognize. So, ganun
Okay.
ka-common ang mental health problem. So, going back to your question, kung lahat tayo vulnerable to developing mental health problems, how much more, mas vulnerable yung meron ng pre-existing mental health problem. Right? So,
okay.
And so, mas mabilis silang mag-relapse. Right? So,
okay.
now more than ever, importante that they learn about their relapse signature. So, think, for example, na kung ako may depression ako, kung ako may psychosis ako ngayon, I should know, how do I know that I am relapsing? It means, how do I know that I am getting sick again? So, lagi ba akong, hindi na ako natutulog, when I start becoming irritated, aggressive, if I notice that, then alam ko na, eto na naman ako. I'm getting sick
Pabalik
again,
na,
right? So,
okay.
it is about early recognition of those relapse signature, we call them relapse signature, that would prompt that person to ask for help. Like I said, now more than ever, and I would encourage everyone, now more than ever, it's easier, it's so easy to access the mental health service
Okay.
through the mental health helpline. Tawag ka ng
Okay.
16,000, you will have a psychologist who will, you can talk to a mental health professional without having, without, it's an anonymous call.
Okay.
So I would advise people who are experiencing stress or a relapse at kung hindi sila komportable pumunta physically sa mental health services, I fully appreciate the stigma around mental health. Your name.
Okay. So, sir, one last more question. Gusto ko yes or no lang. Tumaas ba ngayon ang mental health cases natin dito sa Qatar after the pandemic?
Yes, a big yes.
Okay. Well, thank you, sir. Thank you for that, for discussing to us and giving us more information about this one. So once again, marami po tayong questions dito, but of course, if ever, tawag lang kayo sa 16,000 and then they may be able to answer your questions. So thank you, sir. So at this moment, we will be awarding your certificate, and let's call in Dr. Jane Kada, the president of the Philippine Optometrist here in Qatar. Doc Jane?
Yes, good afternoon, everybody. Philippine Professional Organization Qatar, in coordination with Bayanihan and Heroes Qatar, award the Certificate of Recognition to Mr. Franklin Pineda, Acting Director of Health Education Mental Health Services, Hamad Medical Corporation, in grateful recognition and commendation for these invaluable efforts and explanatory performance as a resource speaker with the topic stress in times of pandemic. During the Together Against COVID-19 webinar, given this 12 of March 2021, Chairman PPOQ, Engineer Adonis Q. Talabo, and President Bayanihan Qatar, Mr. Jerry Ronquillo, and Chairman Emeritus of Heroes Qatar, Mr. Henry Di Maano.
Thank you.
All right. Yeah. Thank you, Doc Jane, and congratulations, Sir Frank, for a job well done, and of course to all of us. All right. Now we have come to about near the end of the activity. So at this point in time, let me welcome to you our fourth, of course, definitely not the least among our speakers, To introduce our last speaker, may we call in our from the Filipino Association of Respiratory Practitioners in Qatar, Miss Jorna R. Pobias. Ma'am Jorna.
Yes, good morning, everyone.
Good morning.
Our speaker for today is a graduate of Bachelor of Science in Nursing in De La Salle Health Science Institute of Dasmariñas, Philippines in year 2005. She works in Asian Hospital and Medical Center from 2005 up to 2011. In the first 2 years, she was assigned as OB-GYN nurse and OR nurse. And in 2007 up to 2011, she functioned as infection prevention and control nurse. This esteemed speaker has these following additions to her credentials as Certified Infection Control by Certification of Board of Infection Control USA, Certified Quality Improvement Associate USA, Masters in Nursing USA, Lead Six Sigma Green Belt for Quality Improvement Project, and Postgraduate Diploma in Infection Control in United Kingdom. She started her venture here in Qatar last 2011 and became the head of infection control, infection prevention and control in Al Wakra Hospital at Hamad Medical Corporation. In short, our speaker for today is pretty much an IPC nurse for 14 years and counting, one of the heroes. Ladies and gentlemen, Miss Fea Altura Vizan.
Thank you very much, ma'am, and thank you, everybody. I would like to also thank Ms. Jorna Bayanihan and Hero Qatar, the Philippine Professional Organization Qatar, Philippine Nurses Association Qatar for inviting me over, and also the Philippine Embassy and its representative, Bayanihan and Hero Qatar. I can see there's 105 people in the group, and I hope that we will clear up some of the notions and misconceptions and any doubts that you have about COVID vaccination. So as sabi ko nga, Instagrammable ang COVID vaccination. So kung gusto mong maging in, kailangan po ay vaccinated ka. So I'll just try po to share my screen. Nako I wonder po if it's showing na. Okay.
Yeah, yes, okay, yeah, we can see it now. Thank you.
Thank you po. So COVID-19 vaccination, the major question is, should I take it? Safe ba siya? Pwede ko ba siyang talagang kunin? So that's the purpose of this next 25 minutes for today. So nothing to disclose. I'm working in Hamad. I'm working in Al Wakra Hospital as infection control. And at the same time po, I'm leading the COVID-19 vaccination in Al Wakra Hospital and Misaid General Hospital. So if you have questions po, this is the perfect time to raise it if it's about the vaccines. So let's get to know each other first. So if it's possible po, para interactive tayo, if anyone has mobile phones, can you please go po to www.menti.com and type in your code 23152243. Tingnan po natin kung gaano kadami ang alam natin tungkol sa COVID vaccine. And para doon natin i-build up yung ating discussion. So punta po kayo sa menti.com and type in po 23152243. Ayan, meron na po tayong mga kasama na naka-on na. Po, alam ko po lahat kayo may mobile phone and lahat merong wifi. Kumbaga po, para dun sa lecture ni Sir Frank, importante ang internet ngayong COVID-19. So I have 6 people na po in Menti, 7. So tingnan natin kung sino po ang may pinakamaraming alam tungkol sa bakuna ngayong araw na to. So 8. Yan po. Ayan na, dumarami na po ang naka-online. So maglalaro lang po tayo ng konti. Titingnan lang natin kung gaano po kadami ang alam natin tungkol sa coronavirus. Okay po, so menti.com and type in your code 23152243. So tingnan po natin. Ayan na, marami na po. So kumbaga po, magtatanong lang po ako and sasagot lang po tayo. How can we prevent COVID-19? So, is it hand hygiene, social distancing, COVID-19 vaccination, or all of the above? Paano po ba mag-prevent? Diniscuss po yan kanina ng ating speaker. So, 5, 4, 3, 2, 1, time's up. Tingnan po natin kung anong sagot. So, marami po ang tama ang sagot. So all of the above po, very important for infection control, hand hygiene, social distancing, and ang importante po is COVID vaccination. So kung mapapansin nyo po, every time na may pandemic tayo, pandemic always bears vaccination. Kumbaga po, kung every time na mayroong bagong organism, every time na magkakaroon ng pandemic, kung naalala nyo kung kayo po ay healthcare worker or kayo po ay nagtatrabaho na on 2009 when we had influenza H1N1, malalaman nyo po na nag-back to normal tayo nung tayo po ay nagkaroon na ng herd immunity. When majority of us were already vaccinated in 2010 with the new vaccine then during the time, which is the flu vaccine H1N1. So ngayon po, COVID-19 came, it's a new SARS coronavirus 2 virus, and ngayon po is nagkaroon na tayo ng different options for COVID-19 vaccination. So kumbaga po, kung gusto nating makabalik into normal, it is really highly encouraged to take the COVID-19 vaccine. So tingnan po natin yung next question dun po sa atin. Sorry, hindi ko siya ma-share dito. So kung sino man po yung nasa menti na, tingnan po natin yung ating next question. Parang hindi na siya lumalabas. So, marami po tayong kailangan na sagutin ngayong araw na to, pero sisimulan po natin doon sa bakit kailangan ng COVID-19 vaccination. So, thank you po doon sa mga sumali sa Menti. So, ang next po natin is, this is po WHO's coronavirus dashboard. And makikita nyo po dito, meron na tayong 446,872 new cases within the last 24 hours. This is a report from March 10. So ganun kadami ang mga nagkakaroon ng COVID-19 across the world. And estimatedly, ang confirmed na po is 117,799,584 people around the world. So with the deaths, it's 2,615,000. So however, importanteng additional data sa WHO dashboard is they also put there na 300 million vaccine doses were already administered across the world. Bakit kaya kailangang i-highlight yung vaccination? Kasi nga po, yun ang maaaring maging susi for the new normal para makabalik tayo sa dati nating buhay, kumbaga pre-COVID. So this is just world in data. This is from this website, puro siya statistics doon. And you will see, hinighlight ko po yung mga yung countries where we might be interested. So United Kingdom kasi sila yung isa doon sa naunang countries to start mass vaccination. You can see Qatar, it is actually growing in numbers. Philippines, we just started recently, mga 2 weeks ago. So kaya kung makikita nyo, nagsisimula pa lang talaga tayo sa Pinas. Pero sa Qatar, medyo marami na. So kung titingnan po natin yung context nito with regards to daily COVID vaccination, so around 0.38 of every 100 people in Qatar are getting vaccinated daily. Yesterday po sa aming vaccination campaign, we've reached 174 hospital staff. And for the whole week, we've given 774 vaccines in Al Wakra Hospital and Misaid alone. So United Kingdom, they're running at 0.52 in every 100 people also daily. Kumbaga, it is really like a marathon. Kailangan makabakuna as many as we can. So kung titingnan po natin, ang sabi ko nga Instagrammable, ako meron na po akong card. Ito ang usong card ngayon. Kumbaga, kung meron kayo ng COVID vaccine card, in kayo. Kung wala pa, kailangan humabol na kayo sa bago. So, ang importante, lalo na sa ating mga Pilipino na gustong umuwi sa Pilipinas, the most important thing is this This one po, itong ating eteras na meron ng golden border. And itong nakalagay na COVID-19 vaccinated. Kasi very important yan, lalo na sa traveling. So kaming mga healthcare workers, lalo na sa Hamad, wala pa po kaming chance na makauwi. Pero dun sa mga po pwede na, ayan po ang gateway. Kumbaga, hindi na kayo kailangang mag-quarantine sa hotel kung kayo ay naka 14 days na after. We'll discuss it further later. Pero yan ang importansya. Kung kayo ay gustong umuwi or nagpaplanong umuwi or nagpaplanong magbakasyon, I'll discuss it later in depth. Pero yan po ang pinaka-importanting marka. So these two things, kung hindi ko kayo ma-pressure magbakuna because of science, I think because of peer pressure and the need to actually go home without a hotel quarantine, yun po siguro ang makakapag bago ng inyong pananaw, kumbaga. So, babalik tayo sa science. So, kung makikita nyo, meron akong 4 na cells dito. Ito si CDC, yung ating number 1. Yan si ating tinatawag na coronavirus. We've been discussing it since morning. And kung makikita nyo, merong mga spikes. That's what we call the spike protein. Importante yan when we're discussing the vaccines. At the same time, itong si coronavirus, kaya siya tinawag na corona kasi it's looking like a crown, kumbaga. So, the idea is, pag hinati mo siya sa gitna, mukha siyang crown, kaya siya corona. So, ang pangalawa, this is what we call in science or in immunology, in infection control, in infectious disease microbiology, we call this as the macrophage. Ang immune system kasi natin, meron tayong panglaban. Kumbaga, kung tayo ay layman, ang usual na sinasabi nyo, or pag may infection, magpapa-CBC, titingnan yung WBC. Pero itong si WBC, kumbaga sa isang country, meron siyang iba't ibang klaseng defense, right? Sa isang country, meron tayong military defense, meron tayong Navy, meron tayong Air Force. So sa WBC, may iba't iba rin tayong klase ng defense. So ang unang-unang dumarating si macrophage, itong may malalaking tentacles na mukhang alien. Ang trabaho niya is to engulf and to swallow any virus, any bacteria, any foreign invader or foreign body. So kung hindi siya normal na parte ng katawan, macrophage po ang kumakain nun. Pero syempre, pag kinain niya, merong mga natitirang crumbs. Yung crumbs na yun ang tinatawag nating antigen. And importante po yung concept na yan kasi yung concept na yan will use for vaccination and ano ba yung purpose ng vaccine and how it works. So once the main organism or the main pathogen is engulfed by the macrophage, yung mga natitirang crumbs na yun na tinatawag nating antigen, doon darating naman itong si number 4. Itong si number 4 ang tinatawag nating B lymphocytes. It's a defensive WBC. It's a part of the defense mechanism. And what it does, it's actually taking or producing antibodies para malabanan si antigen. Yung mga natitira na virus, ayun ang nagkakaroon ng antibody formation. Yung antibody na yon ang kakain and makikipag-away dun sa mga natitirang antigen. And at the same time, itong si number 3, which is the T lymphocytes, yan yung memory cells. At the same time, siya rin yung nagtitake ng defense doon sa actual na invaded na cells. So yung mga healthy cells na nagkaroon na ng sakit, infected na siya, ang nagkikipaglaban naman doon is si T lymphocyte. So itong tatlong to, T, B, and macrophage, this is the most important part of our immune system. So now, how do the vaccine work? Paano ba yan? Bakit kailangan ng synthetic na yan? Or naku, baka tinutusukan nila ako ng COVID, magkaka-COVID ako. Naku, bakit ba ganyan? So kailangan nating intindihin kung paano po ba nag-work ang isang vaccine. So yun nga lang, parang hindi siya nag-play yung ating mga videos ngayon. Anyways, so what happens is the vaccine is developing the immunity by imitating an infection. Kung kanina nagkaroon ng actual na infection, kaya nagkaroon ng macrophage, ng B cells, ng T cells, ang vaccine, ang ginagawa niya is para siyang kunya-kunyari ang sakit. They're imitating an infection, but it will not cause an illness. It cannot cause an illness, but what we want is this vaccine to cause an immune system response. Kumbaga, hindi tayo nagkakaroon ng actual na sakit, pero because of imitating an actual na sakit, nagkakaroon ng production ng tinatawag natin kanina na T lymphocytes and antibodies. So after getting the vaccine, especially po sa ating COVID-19 vaccine, it's more pronounced on the second dose. So, ang first dose, sinatawag namin na primer, kumbaga first time makakita ng katawan mo nun. After the first dose, hindi tayo pwedeng maghubad na ng mask, wala nang social distancing, mag-party na tayo sa corniche. Wala po, magkaka-COVID ka pa din. Kasi it's not automatic. It's not, nakakuha ko ng bakuna ngayon, I'm already immune. It doesn't work that way. We need to have the production of the antibodies. And it's usually always a couple of weeks after. So usually for first dose, for example, of COVID vaccine, both the Pfizer and Moderna, which we have in Qatar, you will take at least 2 weeks for your antibodies to develop on the first dose. So yun yung tinatawag na primer dose. 21 days or 28 days kung Moderna after, you will take your second dose. By the time, dahil sa first dose, meron na akong antibody. When the second dose comes in, doon tayo nagkakaroon ng antibody antigen response or reactogenic response na tinatawag. Doon natin mararamdaman na meron tayong mga symptoms, may minor symptoms, and it's expected and it's normal. Kasi ibig sabihin, yung antibody na na-produce because of your vaccine is now fighting a possible imitation of an infection. So imagine if your body is working against an imitating infection, the memory cell or yung katawan mo, ibig sabihin, naalala niya na kapag nakakita ka ng SARS-CoV-2, kailangan labanan na. So yun ang nangyayari when you have the vaccine. So kaya expected na may minor symptoms. Expected na meron tayo during the time that the body is developing an immunity. So once the imitation infection goes away, yung memory of it remains. Kaya nga sinasabi natin na messenger RNA, which is Pfizer and Moderna, hindi po yan magsistay sa katawan. It will eventually go away, and what remains is the memory of the fight. So that's the memory T lymphocytes. That's the antibodies which was built. Ayun ang kailangan natin. So this T lymphocytes or the memory, it will remember to fight the actual disease in the future. So kapag na-expose ka into an actual COVID-19 disease or an actual SARS-CoV-2 virus, ang mangyayari is it will automatically fight. So yun ang gusto nating mangyari, that you have a chance to fight. Your body has the chance to fight it off. So yan talaga ang idea of getting a vaccination. So kung ako'y vaccinated at ako ay magkaroon ng coronavirus, which we don't have a 100% effective vaccine. We have the highest is 95, which is Pfizer, and 94.1 for Moderna. So meron akong chance that my body will fight it off kasi nakapagbakuna ako. Compared to wala akong bakuna, my body will be attacked and wala akong kalaban-laban, wala akong defense. And that is why we are encouraging vaccination. So it takes a few weeks again for your body to produce T lymphocytes and B lymphocytes after the vaccine. That's why we have to highlight that it is possible to have an infection or to have the disease just before or just after your vaccine, because the vaccine has not had enough time to provide you the protection. Kasi the most common misconception is, naku, nagkaroon ako ng COVID dahil nagkaroon ako ng COVID vaccine. It cannot. Kasi we are not injecting the virus. We're injecting either the RNA or a part of it or a dead part of it. So for example, Pfizer and Moderna, which we have in Qatar, this is the RNA, that's the sequence of the virus. Pero it's not the alive virus na nakakakos ng disease. So this is one thing that we have to understand, how the vaccine works. So unfortunately, hindi gumagana ang ating video, pero I'll just move it on. So how does a new vaccine develop? So iniisip kasi ng iba, ay hindi ako magpapabakuna kasi ano lang yan? Ano lang naman yan? Para tayong ginagawang guinea pig, para tayong hamster. Pinagtitry lang nila tayo tusok-tusok tapos wala naman yan. Parang ano lang yan. Para kumbaga project sa science lang yan. Hindi po totoo. Before ka makapagkaroon ng vaccination campaign for everybody, it goes into a long, rigorous process. So it's called the clinical, where they're using it for animal studies. Once the animal studies are actually effective, tsaka siya papasok sa tao. During that time, phase 1 is when you have 20 to 100 healthy volunteers. And the question that we have to answer is this vaccine safe? Does the vaccine seem to work? Are there any serious side effect, and how is the size of the dose related to the side effects? Ito bang 0.3 micrograms? Ito bang 0.5 micrograms? Kailangan ba lower dose, higher dose, standard dose? Ilang beses ba? Isa, dalawa, gaano katagal? 21 days apart, 14 days apart, 28 days apart. Ito po yung ginagawa on phase 1. On phase 2, meron na tayong hundreds of volunteers. And the idea is, alam na natin from phase 1 that it is safe. So the question in phase 2 is, what are the most common side effects? And at the same time, what are the volunteers' immune system response to the vaccine? So ano na yung effectivity? Yun na yung tinatanong. So kung yung vaccine is hindi safe, hindi aabot ng phase 2. Stop na siya sa phase 1. So phase 2, several hundred na. Phase 3, yan yung naririnig nyo sa Sinovac sa Pilipinas, nasa phase 3 trials. Anong ibig sabihin? Now you will have hundreds or thousands of volunteers. So with regards, for example, to Moderna, they have 21,000 vaccinees. For the Pfizer, it's around 44,000 volunteers. So during this time, what we're looking at is how do people who get the vaccine and people who do not get the vaccine compare? Sino ba ngayon ang mas effective? Itong nabakunahan or itong hindi nabakunahan? May difference ba? May significance ba? Mas malala ba ang disease kapag ikaw ay hindi bakunado kaysa sa ikaw ay bakunado? So yun ang tinatry nating isagot. Again, we go back because now you have hundreds or thousands of volunteers across the country or across different countries. So meron ka ng difference in ethnicity, difference in background, difference in immune system response, difference in status, difference in age. So ngayon may question ulit, is the vaccine safe and effective for these different types of volunteers? And what are the most common side effects? After phase 3, that's when you will do what we call as marketing na. Pwede na, safe na, napatunayan na. So pag napatunayan na, tsaka pa lang siya pwedeng i-release to general population. So yung sinasabi natin na Pfizer and Moderna and the other vaccines which we will be discussing, ito po is tapos na ng clinical trials. Tapos na sa phase 3. They are in post-marketing na. Kumbaga tinitingnan pa rin yan continuously. Meron pa rin bang adverse event na hindi natin nakita before? So yun yung tinitingnan nila at that point. Pero yung pong nandito sa Qatar, we are very lucky. Narinig ko yan sa mga speakers kanina, but we are indeed very lucky kasi we have the most effective vaccines. The question is, are you ready to take it? So that's the most important question. So let's compare. Kasi baka ang question is, bakit itong dalawa lang? Bakit itong iba? Bakit hindi yung isang dose lang na injection na lang kaysa sa dalawa? So bakit nga ba yun ang pinili? So if you're gonna compare, this is an article from WebMD. I will show you all of my references later. So the vaccine developer for Pfizer and Moderna, they're both messenger RNA. So yun yung sinasabi natin. Kumbaga, again, merong part kasi na, naku, ayokong kunin yan kasi babaguhin na ng katawan tao ko. Naku, kung nakakapag blue-eyed and blonde yan, baka po mag-overdose ako. Pero hindi po eh. It's an RNA. It doesn't change you. It will not grow you horns. It will not grow you tails. It will not make you white. It will, mas maganda pa pong magluta. Ito po ay walang effect sa inyong physical features. Hindi siya nababago because it's an RNA. It doesn't change you. DNA is the one which can change. But there's no DNA vaccine. So it's an RNA vaccine. And again, as I've mentioned earlier, it will be released by your body and only the memory of the antibody remains. Okay po. So Pfizer-BioNTech was approved on December 11 with 95% protection for those who are taking this vaccine on the clinical studies. Meanwhile, Moderna, it was approved December 18. Kumbaga, close competition sila. Kung alam nyo po, is Pfizer-BioNTech. Pfizer is German, BioNTech is USA. That's the one that sponsored the study. Moderna is also a US drug. The difference is very minimal. Kung makikita nyo po, 95% dito, dito po 94.1%. So, kung makikita nyo, napakaswerte natin sa Qatar kasi yung pinakamataas na effective percentage of protection, yun yung binili nila. And binibigay nila for free. So, yun talaga ang magandang part. Samantalang tayo, naghahabulan tayo sa Sinovac sa Pilipinas, na ang Sinovac po is a lesser po siya when it comes to the effect. I-discuss po natin yan later. AstraZeneca, this is actually the Oxford Oxford study in UK. It's an inactivated cold virus and it was submitted for emergency use authorization in late March. Bakit po ba emergency use? Yun kasi isa rin sa ating takot. Emergency use yan. Ako, hindi naman yan na-study talaga. Natapos po yung study. Yun nga lang po, FDA and all of the regulatory bodies within each individual countries, it will take them years to approve. Pero given that we are in a pandemic situation, do we have years to approve it? Yun po ang tanong doon. Do we have those years to approve it? Or we have to give an emergency use because the study shows it is protective. So, and it is safe. So, yun po ang ating question doon. Kaya siya ay emergency use authorization. Johnson & Johnson, ito po yung kadalasang gusto nila kasi 1 dose lang, wala nang 2 turok. So, konting sakit lang. Yun nga lang po, it's 66.1% effective on a global study, 70% effective in USA, and 86% effective against severe disease. So, kung i-compare pa rin siya on the first 2 here na nandito sa Qatar, hindi pa rin po siya as effective. Although again, the effectivity is once it reaches actually 60% and above. So, ngayon po, isa-isay natin. Alam ko po ito ay nasa WhatsApp ng kahit sino sa Qatar. Pero again, na-discuss na natin si Moderna, na-discuss na natin si Pfizer, na-discuss na natin si AstraZeneca and Johnson & Johnson. So, Sinopharm or COVID-Vac, which is CoronaVac. That's the one which is available in Philippines. So, ang meron naman po dito is it's an almost the same po doon sa AstraZeneca. It's an inactivated virus, SARS-CoV-2, which is again already considered dead. Ayun po ang ibig sabihin ng inactivated. Ang inactivation po ng isang virus is either through heat, through radiation, or through chemical death. And all of these are already long time ago approved and proven. So ito po yung katulad ng ginagawa natin in activated flu vaccine. So yun po ay actually vaccine na namatay na. Kaya nga lang ang gusto nga natin sa vaccine is the antibody response. So kailangan talagang mag-inject ka para magkaroon ka ng reaction. So yun talaga ang idea. Para pag marami ka na antibody at na-expose ka to the actual disease, you have a standing chance to fight it off. So yun po ang idea doon. So the efficacy is around 79.34%. In the UAE trial, it was 86%. Clinical trial, they are on phase 3 compared to Moderna and Pfizer, which is already finished na, pati AstraZeneca. They are already post-marketing trials na, kumbaga. Ang dose is also 2 doses, 3 weeks apart. So it's almost like Pfizer kasi 3 weeks din si Pfizer-BioNTech. Gamalaya is also another one, reportedly 91.4% efficacy, but it is still an unpublished trial and it is actually done in the European Union. Okay po. So going through the cases or the each one, no? So Pfizer-BioNTech, yan po ang ating ginagamit. Yan po ang binibigay namin sa WACRA and sa MISAID. So we're giving it 2 doses, 3 weeks apart. Majority of HMC is also having Pfizer-BioNTech. So the side effects, sabi nga, kailangan mong magkaroon din talaga ma-expect ng side effects because that means it's reactogenic. Nagre-react ang katawan mo. Ibig sabihin, meron na siyang, kumbaga, nagde-develop ka na antibody. So yun ang idea for that. Ay, sorry po. May tumatawag. Okay po. So, the side effect is fatigue, headaches, chills, muscle pain, especially after the second dose. Honestly, I had mine. Mine is also Pfizer-BioNTech. And meron po akong chills, nagkaroon po akong joint pain, muscle pain for 7 days, but I didn't take any sick leave. Kaya naman siya. You will just take paracetamol and then go to work. Walang problema. So, yun nga lang, may iba rin na talagang mas mahina yung kanilang tolerance. So, may mga sick leave and yun ang kinakatakutan ng mga managers. But again, ang tulad nga na sinasabi namin, it is not an automatic ticket to sick leave. Hindi po siya, ay nagpa-inject ako, sick leave ako. Hindi po siya ganun. I've been there, joint pains, chills, muscle pain, lahat-lahat nakahiga lang sa kama pagkatapos ng trabaho. Pero every day can get up, work for 10 hours and then go home. Wala namang issue. So yun po is talagang common side effect niya. And again, it is available for people 16 years and older. Below 16 years old, wala po tayong clearance. So for Moderna, it's almost the same, 2 doses, 4 weeks apart, almost the same side effects. And again, the effect is usually worse after second dose kasi nga the primer and the booster. So meron na tayong antibody na na-build during the first dose, kaya yung second dose niya mas may effect na. And this is people 18 years and older. So AstraZeneca, 2 doses, a month apart, and almost the same, injection site pain, fever, muscle aches, and headaches. It is now from 18 years old and above as well. Same with the Johnson & Johnson, the difference is 1 dose, but the effect is around 80 or 70 to 80%. And again, people age 18 years old and above. So this is about the cost. So Moderna is at $37. Corona, I was actually shocked na ang Sinovac pala, akala ko mura, yun pala mahal. Yun pa rin ang kinuha ng Pilipinas, pero that's politics, that's not science. And what we have is Pfizer BioNTech, which is $20. Okay. So bibilisan ko na po kasi mukhang maubusan tayo ng oras. So what is the best vaccine to take? Sorry po ulit. The best vaccine to take po will always be the one which is available for you. Ang importante po, Dr. Mastroponda is our head of infectious disease in Alwakra. Hindi importante ang brand. Ang importante po, mabakunahan. Hindi tayo dapat nagde-delay, magpetiks-petiks. This is not the time for that. Kailangan po magkaroon ng bakuna sa lalong madaling panahon para magkaroon ng effect, 95%, 94.1% sa lalong madaling panahon din. So yun po talaga ang importanting part noon. So ngayon, I will just go through the frequently asked questions, tapos po myths and facts, and then I'm almost done. So now, the question is, kapag ako ba'y bakunado at yung eteras ko meron ng gold border, am I exempted for quarantine? 3 days ago or middle of the week, last week, yes. Hindi lang 3 months. This time, it was extended to 6 months. So naka-underline. The quarantine exemption is now valid for a period of 6 months starting 14 days after the second dose. So kung ikaw ay babalik galing sa Pilipinas at ikaw ay fully vaccinated at nakalagpas na ng 14 days from the second dose, hindi na kailangan mag-quarantine in a hotel. So hindi ka na magbabayad. So if your kids naman, which are less than 16 years old, hindi pwedeng bakunahan, if both parents are actually fully vaccinated, the kids will not need to go for quarantine as well. So pwede ng diretso ng home quarantine. So imagine nyo po, kung kayo hindi naniniwala sa science ng vaccination, baka dito po sa science ng economy at hindi magbayad, ito po siguro ang makapag-pressure sa atin magbabakuna. So fully vaccinated people are now exempted from quarantine requirements following travel abroad and following exposure to a COVID-19 positive case. So yan po. Bakit 6 months lang? Kasi 6 months is the recommendation from the American Centers for Disease Control and is based on the current clinical evidence. So as the work is undergoing, malalaman natin until when and until ano yung length of time of full duration of the protection. So during that time po, if it is fully still effective after 6 months, then probably mag-e-extend din ulit sila. So dapat po hindi dinedelay kasi marami po nagsasabi sa akin, ma'am, i-delay ko na lang kasi po magbakasyon na question. Dapat po ang ating ginagawa is you have to actually take the vaccine as close as you can. Okay po, kasi may extend naman, it's a piece of quarantine paper exemption. Pero the vaccine, what we have to do is the effects of it. So how about if meron po akong allergy, pwede po ba akong mag-take? Yes po. Pwede pa rin po kayong mag-take. So ang process po natin across the world is the same. You will have to register. After you register, you will have to be assessed. During assessment, merong 5 questions yan. Pregnant, lactating, immunocompromising drugs like steroids or chemotherapy, are you having anticoagulants use, or do you have any bleeding problems? And if you have allergies to food and drugs, either of the 5, which is yun po ang slides ko na susunod, all of them can take. All of them can take. We just need to, usually pag wala kayo doon, no on any of those 5, You just have to stay 15 minutes post-vaccination. Pero kapag meron kang yes on either of the 5, you'll be seen by a doctor which is available on site on any campaign. Meron po kaming doktor parate, kahit saan man sa Qatar kayo magpabakuna, kahit sa Pilipinas, kahit saan sa mundo. So you will be seen. In Qatar, your order will be manually entered, and then you have to stay with us for 30 minutes. You will get a post-vaccination assessment, and then go home na, see you after 21 days. So pwede pa rin po, kahit na may allergy kayo sa kahit saan, pwede po yan. So when it comes naman next to, is it possible that, masyado na aga. So is it possible that someone who had vaccinated against COVID can still get affected? Yes po. Honestly, oo. Kasi wala naman tayong 100% effective drug. Ang pinakamataas nga is 95 to 94.1%, which is Pfizer and Moderna, which is available in Qatar. Ang sinasabi lang po, you have lesser side effects, you have lesser chance of being hospitalized, lesser chance for ICU admission, and therefore there are gonna be lesser mortality risk. So yun ang pinaglalaban ng vaccine. Okay po? So the next one is, ang dami po nito, hindi po ako magpapabakuna ma'am kasi po nakakabaog daw. Hindi po yan. Saan po ba nanggaling yun? Wala po. There is no evidence and no theoretical reason at all whatsoever. There's no scientific background na kapag ikaw ay nagpabakuna, hindi ka na mabubuntis or hindi ka na makakabuntis kung ano man doon. So there's no such thing po. People of reproductive age should get their COVID-19 vaccine when they receive their invitation. So if you are scheduled, you come, including people who are trying to get pregnant or thinking about having a baby in the future. Ako po ay nagkaroon ng bakuna. Meron nga po kaming nabakunahan after noon, nabuntis agad. Hindi ngayon siya ay nanghihingi ng OB-GYN clearance for the second dose. So kumbaga po, walang effect yan sa inyong fertility or sa inyong reproductive system. So what if you are a woman of childbearing age, pregnant, breastfeeding, or planning to breastfeed? So these are the key points to consider. Ito po is from NHS Scotland. So lahat po na sinasabi ko is back up by evidence, back up by science. So sabi nga natin paulit-ulit for the last 4 is wag nyo pong problemahin yung ating kumbaga yung facts dapat is strong. So Facebook is not a fact finding committee. YouTube is not. Yung mga nakikita nyo, yung Instagram na famous or internet famous, makareact lang, hindi po dapat yan ang base ng ating desisyon. Ang basehan ng ating desisyon dapat po is yung mga talagang, kumbaga po, ating organizations which are actually handling these kinds of patients. So ito po is from the NHS Scotland, so UK, Scotland, Public Health. If you are pregnant and at a higher risk of catching COVID-19, most likely because you are a healthcare worker or you are a first responder, so you are actually considered to get the vaccine. And you have to discuss it with your midwife or your obstetrician. And kung makikita nyo sa moph.gov.qa, they just released it yesterday. Now, you can be vaccinated, but you have to talk with your obstetrician, especially if you are high risk. So if you are pregnant and not in this higher risk groups, then you can be vaccinated, but after your pregnancy is over. At the same time, if you have had the first dose and then you become pregnant, there's 2 options. You can delay the second dose until after your pregnancy. Unless you are at high risk, by then you can still take it after 21 days or 28 days if Moderna. So is the vaccine safe in pregnancy? So Pfizer-BioNTech, it was from non-clinical studies, it was reviewed by the Medicines and Healthcare Product Regulatory Agency and World Health Organization, USA, Canada, and Europe, and they raised no concern about safety in pregnancy. Same is true with AstraZeneca, raised no concern about safety in pregnancy, and the Joint Commission on Vaccine has recognized that the potential benefits of vaccination are particularly important for some pregnant women. So this is also the Royal College of Obstetrician and Gynecologists, the Royal College of Midwives, UK teratology. Teratology, ibig sabihin po yung nagkakaroon ng side effect dahil sa gamot at nagkakaroon ng problema sa bata sa loob ng tiyan. So even the British Teratology Information Service and the Obstetric Medicine Society, McDonald Obstetric Medicine Society, all of them said that if you are a healthcare worker, if you are a social care worker, if you are at higher risk, you can actually take the vaccine. So who can be vaccinated? Again, those with high risk because of greater risk for severe illness, or those who are health and social care workers who are at very high risk of catching COVID-19. This is just again to share with you ano ba yung decision tree. Baka makatulong to sa inyo. You are at higher risk of catching COVID if you are someone in your household which is a healthcare worker, a social worker, and works in a care home. If your community has a high risk or increasing rate of COVID infection, if you have frequently contact with people outside your home, if you are not able to comply with social distancing for the rest of your pregnancy, if you live in a crowded household, if you are Black or Asian ethnicity, or from another minority ethnicity background, which is found to have actually higher rates of COVID-19, then you are at higher risk of catching COVID. You have to take the vaccine. You are higher risk also of becoming unwell with COVID if you have underlying medical condition as such as immune problems, diabetes, high blood pressure, heart disease, asthma. Kung ikaw ay may mga ganyang klaseng comorbidity or underlying medical condition, you should take your vaccine. If you are overweight, beep beep, kung tayo ay medyo naparami ng talabat, kung sabi nga ni Sir Frank kanina, ayan, mas higher ang risk of becoming unwell because of COVID. If you are over the age of 35, naku po kasama na ako dyan, so kailangan magpabakuna. If you are in your third trimester of pregnancy over 28 weeks, although they said it doesn't matter which week in pregnancy you are, so you are actually encouraged to take your vaccine. So if you are saying yes to any of those checklists, so what should you do? If you are at higher risk of catching COVID-19, you should consider getting the vaccine. If you are at higher risk of becoming seriously unwell, then you should consider getting the vaccine. And if you have further questions or you're unsure, talk with your obstetrician or your midwife. So yan po ang sagot dyan. So for breastfeeding, again, there's no data on safety to breastfeeding or on breastfed infant, but WHO and the Joint Committee on Vaccination and Immunization also recommend that the vaccine can be received while breastfeeding. And if you are breastfeeding or planning to breastfeed, you can continue the breastfeeding right after your vaccination. So kumbaga so far, wala pa tayong rason para mag-stop ng vaccine. Okay, so if you are taking immunosuppressive medicine, so this is again a British guideline, you can still take again the vaccine even if you are taking steroids, if you're taking chemotherapy. So we just have to discuss with your doctor kung ano yung best schedule for you to get the vaccine, but you are recommended to take the vaccine. So if you are bleeding disorder, if you are treated with warfarin, the Public Health England immunization against infectious disease, or what they call as the Green Book, also states that you can take the vaccine even if it is intramuscularly given. Hindi lang kailangan tawag dito, kumbaga masahiin. Okay? So you don't rub it at least for 2 minutes and you just have to apply firm pressure, but you can still take the medicine. So far, hopefully na i-encourage na natin kayo magpabakuna, pero so far wala pang humihindi na hindi pwedeng magpabakuna. If you have bleeding disorder, the same. If you are being treated, if you are patient with hemophilia, you can still receive your COVID vaccine. We just have to schedule it shortly after the treatment is given. So hindi on the same day, kumbaga. So going now to fact and myth. So fact and myth natin is the vaccine will not be effective against the new strain, so I should wait? No. The presence of the new strain means that maraming tao na hindi na bakunahan, na nagkakaroon ng sakit, kaya nagkakaroon ng mutation. And specific geographical location is the reason for that, and specific ethnicity. That's why if you can see, yung sinabi kanina ni Ma'am, dun sa first session natin, merong Brazil strain, merong South African strain, may British strain. Bakit? Kasi it's geographical location. So different people there, sa loob ng taong yon, nagkakaroon ng mutation, yung bagong mutation na yon ang nagsispread. So kung tayo ay bakunado, that's what we call as magkakaroon tayo ng herd immunity. Kumbaga, masistop ang pagkakaroon ng bagong strain kung tayo ay nabakunahan na. So also there are a number of studies across different companies such as Moderna and Pfizer saying that it has a protective immunity to those new vaccine strain or new COVID-19 strains. When it comes naman, ayan, konting-konti na lang, the vaccine will give me COVID? Hindi nga po. Kasi nga po, ang hinahanap natin is yung symptom. Kung kayo ay nabakunahan at nagkaroon ng COVID, hindi po yun dahil dun sa bakuna. Yun po ay dahil kayo ay kayo ay incubating na. Kayo ay nandoon na sa inyo si COVID, inaantay lang niya na kayo ay magkaroon ng full low immunity para mag full blown siya. So, kumbaga kung makikita niyo po yung mga nabakunahan ng first dose, hindi yun agad-agad mag-e-effect. And for Pfizer itself, 2 weeks after the first dose, you will have 50 to 55% effectivity. 2 weeks after when you get your, or 21 days after when you get your second dose, you need 2 weeks pa to get 95% effectivity. So during the time na hindi pa tayo nakakabuo ng antibodies, you are at risk to develop COVID. And ang napansin namin, if you are vaccinated and you get COVID, the risk becomes lower. Ang symptoms becomes smaller and it becomes milder. So yun ang nagiging reason to get the vaccine. So again, ako tapos na. Ikaw tapos ka na ba? Ako tapos na. So kung ako man ay magkaroon ng COVID, hindi na ako matatakot na ako ay maaaring mamatay. Ako ay mas relaxed dahil my body has a fighting chance, has a chance to actually survive. Yun ang pinaglalaban ng bakuna. So I have already had COVID-19, hindi na ako magpapabakuna, nagkaroon ako. Actually, the natural immunity from the disease is protective until 90 days. Yan po ang study. So after 90 days na nagka-COVID ka, your immunity decreases and you are now at risk for a new reinfection na na-raise natin kanina. So para hindi ka magka-reinfection, anong kailangan gawin? Kailangan magkaroon ng bakuna. Otherwise, your body alone cannot support not having a second reinfection. So it is possible to be reinfected, kaya you have to still take the vaccine 40 days from the first PCR test or 90 days from the first PCR test. By that time, 90 days nagwe-wane off na, pababa na ang immunity mo at pwede ka magkaroon ulit. So kailangan mabakunahan ulit. So yun po ang ating discussion dyan. Wait lang po At ang aking slides mukhang, ayan. So, kung ako po ay nagawa ko ang aking trabaho ngayon at kayo'y na-encourage at naengganyo magpabakuna, you register yourself to the COVID-19, moph.gov.qa. Ang una nyo makikita is COVID-19. Click on the link and you will see here, registration for COVID-19 vaccine. Register now, click that part, and then makikita nyo po yung registration. So kung kayo po ay may chronic condition, kung kayo po ay healthcare worker, or if you are above 50 years old, yan po ang pinaprioritize ng government na magkaroon ng bakuna. So, kung baga po, yan po ang una nilang tatawagan. Unfortunately, sa amin sa ospital, ang priority po muna natin is yung mga nagtatrabaho din sa ospital. So, kailangan natin alagaan ang ating frontline worker. So, hindi pa kami nabigyan ng clearance na magbigay sa public. So, ang pinaka-importante po is makapag-raise kayo, makapag-register kayo. Kung hindi nyo po alam yung link, moph.gov.qa. Kung nahihirapan alalahanin, punta sa ETERAS. Sa ETERAS may notification. Meron po kayong i-click doon sa online registration. And kayo po ay mapapasok doon sa online registration, which is like this. Okay po. So ayan po ang ating reference, and that's actually the end of our session po. So hopefully naingganyo po kayong magpabakuna. So thank you po.
Well, sure na sure siguro, Ma'am Thea, regarding sa explanation mo. I think they are now persuaded regarding kuha ng vaccine. All right. Well, thank you, Ms. Thea. Okay, sorry, i-mute muna kita kasi ayan. Okay. So actually, we have a lot of questions here coming from our participants. Really interested sila sa regarding sa COVID-19 vaccine, because syempre it's kumbaga yun yung trending eh. Sabi mo nga na Instagrammable di ba? Kaya nga pag pumunta ka ng mall, pag kung saang man pumunta ka, tapos pinapapakita mo yung etras mo, nakita mo vaccinated ka, feeling mo you're unique, you're different, tapos parang privileged ka. So mga ganung bagay. Yeah. So Ma'am Thea, before we end, there are a lot of questions here. I think we have someone who would like to ask his question. Sir President po ng Filipino Association of Respiratory Physicians. Si President Jason. Sir?
Yes, sir. Yes, sir. Hello?
Yes,
sir. Yeah.
Okay. Yes, sir. Yes, ma'am. Good afternoon, Ma'am Tia, and thank you for your wonderful presentation. It was really informative, and So my question is, as we all know that sinabi mo about dun sa effectiveness of Pfizer, Moderna, may certain percentage of sabihin natin na hindi siya effective. Let's say 5% or 6% from those vaccines. So my question now is, with this 5% of, let's say, na hindi siya effective, are we considering to receive a booster or something like, just like flu vaccines? We are getting a booster in a yearly basis. So, or kailangan ba talaga ng booster?
Actually po, salamat po sa question. Nag-feedback po ata. So, ang sagot po doon is, kapag po tayo ay naka 1 year na down the road sa ating vaccination, doon pa lang natin malalaman ang length of effectivity of the vaccine. So, noong 2010, nung nag-start tayo ng flu vaccine, it took us a year or two bago natin ma-realize na we need to do it in an annual basis, because yung sa ating COVID vaccine, actually po kaya tayo gumagawa ng annual because there's a lot of variants, there's a lot of strains. So ang ginagawa po ng influenza surveillance from the World Health Organization, tinitingnan niya yung top 3 na most common strains, and yun ang nilalagay niya in every year's vaccine. So ngayon po, ang COVID vaccine, nakikita natin, since it's an RNA virus like the flu, nagbabago rin siya ng strain and nagkakaroon na ng variant. So for that purpose, malalaman po natin in a year's time kung gaano ka-frequent. Personally po, sana maging katulad siya ng meningococcal. Yung meningococcal po kasi every 5 years, pneumococcal is every 3 years. So sana hindi siya tulad ng flu na every year may turok. Pero yun po ang magiging study. So we will have to wait a while po para malaman kung ang effectivity niya ba will take us a year, it will take us every 2 years. So yun po ang magiging kumbaga po, to find out. Abangan ang susunod na kabanata pa tayo dyan, sir. Pero kumbaga, since hindi nga siya 100%, we can still have COVID talaga, yung 6% and 5%, and even yung COVID na yon, ang nagiging difference lang is lesser yung symptoms, lesser yung chances to be admitted in ICU because lesser ang chance for severe pneumonia, and at the same time, because lesser ang risk, lesser ang severe pneumonia, lesser ang ating ICU admission, lesser ang hospitalization, it leads to lesser mortality as well. So yun ang ginagamit natin na sandata doon sa vaccine na yon. Just for your information po, yung ating flu vaccine na pinaglalaban namin taon-taon, that is 30 to 45% effective. Ito po is 94.1 to 95% effective. Napakalaking difference when it comes to protection and effectivity. So kung tayo ay naniniwala sa flu vaccine, it is but talagang scientific to also believe in the COVID vaccination po. Hopefully it answers po.
Thank you so much, ma'am. Thank you.
Thank you po.
Okay, thank you, President Quezon. I hope Ms. Kaya answered your question. Now, actually, Doc, may mga questions dito. Lahat ba dito sa Qatar mapabakunahan?
Actually po, just like any other countries, the actual goal of each country is to vaccinate everybody. Yun nga lang po, since mas marami yung risk sa iba, so just like any other country po, talagang may prioritization. So kung maalala nyo po, noong umpisa, 75 years old lang. Tapos po, naging 65, tapos naging 60, ngayon umabot na ng 50. So yun po talaga kasi ang maganda pong ginawa ng Qatar, kumbaga maganda rin naman sa ibang country, yun nga lang po, for purpose of comparison lang. For example po, sa UK, kaya nakita niyo yung curve, ang taas bigla, kasi ang UK government decided to vaccinate everybody with 1 dose. Okay. Yun nga lang po, yung kanilang second dose is not the same. So depende kung anong available during that time. So yun nga lang ang napansin ko po na ginawa ng Qatar, which I agree po is good, is talagang prioritize nila tapos same yung first dose sa second dose. So yung 95%, 94.1% mo, yun ang clinical trials of the same drug. Wala pa po tayong trials ngayon, kumbaga ongoing pa yung trials na pag naghalo. So, kumbaga po, ang alam ko at ang intindi ko po talagang ang goal is to vaccinate everybody. So, antay-antay lang po tayo ng ating turn. Pero kung kayo po ay willing, mag-register na kayo agad para po
Okay.
malaman ng ministry.
Ayun. All right. There is one participant here. Two more questions. So ito yung second to the last. Miss, okay. I think she lowered her hand. No worries. Okay. Well, may question dito from PSD student natin from Philippine School of Doha. Estudyante po siya. She is 18 years old and maybe she wants to have a vaccine. Nagtatanong po siya, if ever po below 18 ka, like 16 or 17 years old, kailangan po ba ng consent from parent if ever magpa-vaccine?
So far, wala kaming nakita na guidelines for that. Ang question lang doon is to register. Most likely, the ministry will follow up also kung
Okay.
alam ba ng parents mo yan. So most likely ganun siya. Pero so far, we vaccinated kasi 18 years old na Qatari patient. Okay naman sila. Kasi lahat po ng ating vaccination sa Qatar ay nasa Cerner. Lahat po yan ay documented legally. So
Okay.
kaya I doubt po na magkakaroon ng problema with regards to the vaccination. But most likely kung member of the public, ministry will actually probably get consent from the parents. And at the
Okay.
same time, siguro hindi ka naman papupuntahin doon sa vaccination center na ikaw lang din mag-isa. Siguro most likely they will ask also a guardian to be with you.
Okay.
So Pfizer dapat ang kukunin kasi Moderna po is 18 years old and above. So
Okay,
16
yes,
years
ma'am.
old and above will be Pfizer.
Pfizer. Okay. So regarding po, di ba, sabi mo kanina, if ever nagka-COVID na, so kailangan pa rin magpa-vaccine, right? So
Yes.
may days po ba, for example, may tanong kasi dito na may specified number of days po ba after mo nag-okay ka sa COVID and then mag-vaccine ka po?
Kailangan po is a minimum of 40 days from the first
40 days.
PCR test. 40. 40 days from the first PCR test. Yun po
Okay.
yung pinakamaagang pwedeng magpabakuna. Ang purpose po noon is kasi yung katawan mo may antibodies pa naturally from the COVID disease. So ngayon pag nagbakuna tayo hindi gagana kasi yung katawan mo nilalabanan niya pa yung actual na disease. So hindi ka pa pwede. So yun po siya. So the earliest is 40 days, pero for sure 90 days po after the first PCR test kailangan magpabakuna na.
Okay. All right. Thank you, ma'am. Okay, actually marami pang tanong dito pero because we are time limited, okay,
Opo.
maybe
Sagutin ko na lang po, tatype ko na lang.
sige po, okay. So Ma'am Fea, thank you so much for that very informative discussion regarding COVID-19 vaccine. So therefore, sinabi mo kanina, is it safe? So ngayon, we would like to ask you, is it really safe to have the vaccine?
Yes, I had it.
Okay. So we heard na safe po magpa-vaccine po from Ma'am Fea. And then thank you so much, ma'am. And I know na kahit ako nagpa-vaccine na kahit ngayon, if ever hindi pa ako nakapa-vaccine, I am persuaded by the statistics, by the data that you are showing. Well, thank you so much. So at this point in time, all right, at this point in time, let us call in the president of Bayanihan Qatar, Mr. Jerry Ronquillo, to award the certificate of recognition to Ms. Fea Visan. Sir? Once again, let us call in Mr. Jerry Ronquillo to award the certificate of recognition to our last resource speaker for today.
Hindi ko makita yung screen. Hindi makita.
Makita.
Chris, andyan na si Chris.
Nandiyan si Sir Jerry. I-swipe mo lang, sir, para nandyan siguro sa gilid.
Hindi ko makita yung
Ikaw na lang magbasa, Chris, para
Sige. Sir, nakita mo na po yung screen mo. Sir Jerry?
Pre-speech, naka-cellphone nata si, si
Okay,
President.
sige. All right, sige. Sometimes we need to deal with the challenges no, regarding this matter. Okay, so thank you so much. So let me, on behalf of Sir Jerry Ronquillo, I would like to award this certificate of recognition, which states Philippine Professional Organization Qatar, in coordination with Bayanihan and Hero Qatar, award this certificate of recognition to Ms. Peya Altura Bisan, Head Hospital Infection Prevention and Control, Hamad Medical Corporation, in grateful recognition and commendation for her invaluable efforts and exemplary performance as a resource speaker with the topic COVID-19 vaccines. Are they safe? During the Together Against COVID-19 webinar, given this 12th of March 2021, signed by President Bayanihan Qatar, Mr. Jerry Ronquillo, Chairman PPOQ, Engineer Adonis Q. Talabo, and the Chairman Emeritus of Hero Qatar, Mr. Henry Dinaano. Ma'am, in behalf of Sir Jerry Ronquillo, congratulations. And thank you so much. Okay. Well, thank you so much for this matter. Sir Jerry, do you have any short message to add to our fellow community? And of course, to all the Bayanihan people who are attending our activity today.
Hello, good afternoon.
Hi, sir. Good afternoon. Yes, we can hear you. Yeah.
Klaro ba? Thank you sa lahat ng mga speakers, lahat sa organizers, sa PPO, sa lahat ng organization na nagsama-sama. So, napakaganda. Sana hiling lang ng community in behalf of Bayanihan Qatar. Masundan pa ulit yung ating COVID awareness dahil kailangan talaga ng ating community ngayon dahil madalas kung ano-anong information ang nakukuha ng ating mga kababayan kaya nagkaroon ng kalituhan. No? So muli, napakaganda ng ating programa na nasimulan. Sana mayroon pang mga susunod. So maraming salamat po sa inyong lahat.
All right, thank you, sir. So once again, thank you everyone for participating, and thank you to all our participants who are here right now. I know off ninyo ngayon, and I know you have a lot to do today, but still you decided to be part of this activity. Sana po may natutunan tayong lahat, and sana po i-apply natin yung natutunan natin ngayon, hindi lang po dito, kundi po para sa ating everyday daily living. Okay? So on behalf of the Philippine Professional Organizations Qatar,
Sandali.
yes, Chair?
Hindi mo nabasa yung message na may announcement tayo?
May announcement pa? Sorry, hindi na ako naka-open. Yes, sir. Okay, you may announce it, sir. Ikaw na lang po mag-announce.
Okay, basa na lang.
Basahin ko na lang. Wait. Ano pa?
Natabunan na pre-speech. I-message ko sa WhatsApp mo.
Sige, ako na lang. Umalis na yung mga tao. In behalf sa Philippine Overseas Labor Office and Philippine Embassy, meron silang advance info to. It will come out soon. Meron silang search for outstanding healthcare professional. So this is for both group category and individual category. So yung mga nasa health sector, pwede kayong mag-nominate ng somebody na karapat-dapat sa ano na to.
Chairman, sorry, pa-open ang camera mo.
Chairman, paano po mag-nominate? So may link po yan?
Lalabas to sa embassy na announcement later.
Update na lang po, Chairman, sa group. Thank you.
Okay po. So we can coordinate with the POLOA. Thank you.
All right. Okay. So just to remind everyone that the Philippine Overseas Labor Office, Philippine Embassy, sinasabi ni Chair, Overseas Workers Welfare Administration of the Department of Labor and Employment is conducting a search for outstanding healthcare professionals for both group category and individual category. So more info na lang siguro to follow, and thank you so much, Chairman, for that announcement. And once again, on behalf of all the members, the 14 strong members of the Philippine Professional Organization, Qatar, and of course the Bayanihan, and as well as the Hero Qatar, we would like to thank you everyone for coming to our event, and hopefully, and we are looking forward to a more prosperous and more informational event in the future. So we will be giving your certificates to those who have registered. We will be sending you the certificates through your email within maybe give us most probably 1 to 2 weeks. All right. So be safe and thank you everyone. Thank you for coming and goodbye. Congratulations to all as well.
Congratulations po. Bye-bye.
Thank you.
Muna.
Isang bayan, makulay ang pinagmulan. Bagong bayani ang taglay niyang kayamanan. Tanyag dahil pagbabago'y mapayapang pinaglaban. Isang perlas kung saan sumisikat ang nakilala ng mundo, katapangan mo at kabutihan ng iyong puso. Ipagpatuloy mo, adikain ng mga bayaning nagbuwis ng buhay
Paki-on ang kamera para picture.
Muling buhayin ang alab at ningas ng pag-ibig mo. Iwagayway pandilang sa gisag ng dangal ng tapang at ng kalayaan mo. Ipakita sa mundo ang diwang makabayang nasa puso't isip mo. Ika'y isang lahing pinakala ng may kapal. Katatagan at tapang mo'y inubog ng kasaysayan. Sa katapatan mo, karangalan ang iyong lipin ay itatanghal. Kahit saan pa man, taas noo kang hahakbang. Pilipino ka, huwaran ng paglilingkod. Sa mundo'y siyang
Saan mang panig ng mundo, laging nangatangking galing mo at talino. At pinatunayan mo sa bayanihan at pagkakaisa'y makakamtang lahat pangarap mo. Muling buhayin ang alab at ningas ng pag-ibig mo. Iwagayway pandilang sa gisag ng lahat mararating. Sa pagsisikap mo, ika'y magniningning. Magniningning. Ika'y isang lahing pinagpala ng may kapal. Katatagan at tapang mo'y inubog ng kasaysayan. Sa katapatan mo, karangalan ng iyong libing ay itatanghal. Kahit saan pa man, taas noo kang hahakbang. Pilipino ka. Pilipino ka. Pilipino ka. Pilipino ka. Pilipino ka. Huwaran ng paglilingkod. Sa mundo'y siyang gabay.